Thank you. Is that how you gather them at the state house?
I need a gavel.
Is that how you get your committee?
All right. Thank you, everyone. We try to be punctual, so it is 1:30. And we'll start. I know that we have a few members that are via Zoom. Thank you for coming in via Zoom, and I know that Ella and Joe aren't feeling well, so thank you very much for being considerate of us all and staying at a distance and not getting us your colds. So I appreciate that. So, all right, well, I want to welcome you all, and I want to welcome everyone who is our guest here today, and anyone who's come in via Zoom to be with us as we hold the monthly meeting of the Recovery Council. So I just want to start out with a couple things before we get into the agenda. One is, I want to recognize that personally, I know that this has been a bad month, that we lost more people than from the drug overdose, and I know that it's affected people here on the council, and just want you to make sure that our hearts go out to all of you, and it just shows us how important our work is, and how the urgency of the work that we do, and our due diligence to save lives, because people are important. And I want to just recognize that. The second piece that I want to say is, as the chair, is that I just want to give just a reminder to people that it's important that we do this work with open minds. That we all are 15 people that sit at this table with 15 sets of values and different views. But we have to continue to be respectful of those and be very open-minded, because we can learn from each and every one of us, and it's important that we stay connected and open-minded about things that are brought before us. It may be things that we thought maybe weren't our priority when we started, but as we learn more, we say, well, maybe it is. Again, just a reminder that if we can be respectful of all views and be kind, it would be appreciated. So thank you. I am going to just quickly go through the agenda. As last meeting, we decided to move things around a little. So the agenda is we'll welcome, we'll review the minutes, we'll have reports by the coordinator. We'll have an education session, which you ask for every time that I have a list of things that you want an education session on. We do, because last month we were supposed to have a presentation. We have one today from Scott Gagnon. I'll remind you, this is the group that we voted on subgroup that we voted on, I think back in December, to form, to look at prevention programs and get some technical assistance. Then we'll have reports from finance, program grants, and governance. We have a few pieces of other business, maybe, I don't know. And then before we leave, we will set the agenda for the next council meeting and hopefully be out of here at 4:30. So I'm going to keep people on task. And I am going to ask for help when we have people up. Sometimes I forget to look. So please remind me that there's someone on Zoom with their hand up and I can recognize them. All right, so let's start the meeting with a quick introduction so that people that are watching via Zoom knows who's here and who's attending via Zoom. So you want to start?
Paul Vinsel, addiction medicine physician with Clark County Mental Health Services, soon to be with Spurwink.
Lydia Krax, I serve in the Maine House of Representatives and am a clinical social worker in private practice.
Betsy Fitzgerald, representing the counties.
Mary Coyne, coordinator for the Maine Public Council.
Pat Kimball, Chair of the Recovery Council.
Brendan O'Neill with the Attorney General's Office.
Haley Tarango, also with the Attorney General's Office.
I'm Liz Blackwell-Moore, she, her, my pronouns, and I'm the Director of Public Health for Cumberland County Public Health Department.
Hi, I'm Miles Willett. I'm a clinical supervisor for an outpatient facility in Aroostook County. I'm also someone who was directly affected by the opioid crisis. And welcome the folks that we have here as well.
Bruce Naughton, I'm with the Maine Reentry Network. I'm a person in long-term recovery and a person who lives with mental health challenges.
Good afternoon, everyone. Benjamin Mann, Deputy Commissioner of Finance, the Department of Health and Human Services here in Maine.
Hi, I'm Todd Brackett. I'm the Sheriff in Lincoln County.
Thank you. And those on Zoom, Joe?
Good afternoon, everybody. My name is Joe Everett, and I'm the president and CEO.
This is my fault, sorry, Joe.
Sorry, Joe, wait a minute. Now go.
No, don't go yet.
Thank you. Thanks, everyone. Good afternoon. I'm Joe
We're fixing
Everett,
it.
the president. Can you hear me?
Yep.
Sorry. Joe Everett, president and CEO of the Opportunity Alliance here in South Portland, and a member of the council and chair of the Program and Grants Committee.
Thank you. Ella?
I'm Ella Capin with the Attorney General's office.
Christy? Oh, Chastity. Why do I want to say that today? Chastity. Sorry.
It happens a lot. Chastity Toole. I'm a person with lived experience of chaotic substance use, and I'm the Northern Maine Director of Harm Reduction Services at Maine Access Point.
Eric?
Hi, good afternoon. My name is Eric Small. I'm the Deputy Police Chief in Sanford, Maine. I represent the litigating subdivisions.
Thank you. And I think I got everybody on. And everybody. All right. Thank you. So before we start, I do have one quick announcement to make that we have been asked by appropriations to meet with some of the membership to discuss our funding on Monday, I believe, at 2 o'clock. They just want to know where our funding is going, how much we've spent. They have a couple questions in regard to municipalities and how municipalities are coordinating that, and I can't remember what else, but we will go. The Attorney General will be there. Okay, they are asking, there are 3 legislative committees who recommended opiate settlement funds from one of the buckets. And that is LD 1714, which is the tax for recovery centers, MAT and county jails, and low barrier shelters and housing. Our understanding is that the Maine Recovery Council will not fund projects to replace state funding, but the Maine Recovery funds are for these very purposes. Do we just not fund them in order to have the Maine Recovery Council step in? So we will respond to that. And I will let you know how it goes. So, any questions about that?
It's at 3 o'clock. 3 o'clock, not 2 o'clock.
Oh, it's 3 o'clock, not 2 o'clock.
I'm talking at the 2 o'clock in the DHHS budget.
Anyway, so if the questions will be there, I will tell them about the work that we're doing and move forward and remind them that under what guidelines the council exists and what our plans are for the money. And again, I think we will have a lot to say at appropriations because today is going to be a very helpful meeting as I'm really excited about some of the information we have coming before committee meetings. So if no other questions, I'm going to move down the agenda. All right, I'm looking, you all have got a copy of the minutes from the last meeting and I'm looking for discussion or a motion.
Actually, where are the copy of the minutes?
They're posted on the website, but I don't think they got included with the materials that Mary sent.
Okay.
They did not. Sorry about that.
No, I also, for some reason, never get any of the attachments that you send. They get like unzipped and removed from my emails. That's my own problem. So I'll have to work with you on that. But they're in the website.
On the calendar page, yeah.
Okay.
Today's
So
materials.
I have not reviewed them, so I will abstain from discussion.
So I'm looking for a motion.
Motion to accept the minutes.
Motion to accept the minutes of last meeting. Do I hear a second?
Second.
Second. Any further discussion? I see none. Can you call a roll, please?
Yes.
Liz Blackwell-Moore,
Abstain.
Todd Brackett,
Yes.
Lydia Krebs,
Yes.
Joe Everett,
Yes.
Betsy Fitzgerald,
Yes.
Courtney Gary Allen, Pat Kimball,
Yes.
Ben Mann,
Yes.
Bruce Nobin,
Yes.
Miles Olet,
Yes.
Eric Small,
Yes.
Gordon Smith,
Yes.
Keena Thacker,
She's not here today.
Chastity Toole,
Yes.
and Paul Binsel.
Yes.
Thank you. And if anybody else has problems with that zip drive, please see Mary and we'll get that fixed in between now and the next meeting. So the motion carries. Thank you very much. Okay, I am going to ask Mary to give a report, although I will share with you Mary's report will be somewhat short today, because the majority of what Mary wants to talk about, she will talk about during the grants and program subcommittee reports.
All right. So similar to last month, a lot of my work has been around looking at the contracts for the awards that have already been approved by the council. So I've been working with Brendan and other members of his team to gather information from the organizations who are receiving the funds and help me to translate that into a contract, which eventually will be a contract template for us to utilize in the future. So hopefully through this process, that will be easier and quicker. We've also been doing a lot of work around the grant application, which we'll talk about later, as Pat mentioned. Ella and I have met with a few different organizations, including other states, to talk to them about best practices and also experiences administering the grants, if they had any recommendations for us as we go about that, which has been very helpful. We were also lucky to meet with the John T. Gorman Foundation and a few others who were very helpful. We met with Nashby and their team who oversee what all of the states are doing to provide guidance and recommendations. So that was a very helpful conversation to be able to have one-on-one with them and hear that we were not alone in a lot of our questions and things that we were needing support around. We've also been working through with the grant, again, what the actual contents will be of the grant application for applicants to fill out, how to make sure we're checking all of our boxes while also making it accessible and not too many pages. Looking at what, further down the line, what type of evaluation and scoring measures we should put out, and what sort of reporting is required in the MOU for us and all of that. So that will be discussed, as I mentioned, later on. And the hope is to speak with the council today around a few big picture topics for the grant application, and then bring the budget portion of that to the Finance Committee next week to discuss in more detail. And then the Grant and Programs Committee, who also meets next week, will discuss what the priority areas will be under each of the 4 pillars. And I believe we mentioned this last council meeting, although it might have been at the committee meeting. So we're moving forward with a grant application that's open to everybody, but does have selected strategies and programs that will be prioritized in scoring, and to let the public know this is what the council is looking for this first round. See, I've also been able to meet with a couple other subdivisions. State County invited me to the commissioners meeting. Miles was there as well, which was really great. I spoke to them a little bit about what we were doing as they get started. So they're working to develop, similar to a council, couple member board to help move them along in their process. So I've mentioned that we're available with resources and support as needed, but that's something that I continue to keep in mind as I hear from the subdivisions around what their needs are, both in the short term and the long term. Let's see. Oh, and I was also invited, which is very interesting, the Franklin County Military and Community Network, which was really interesting to hear from other organizations who are supporting Maine's military and veterans, many of whom also consider themselves to be living with substance use. And so there was a lot of overlap and interesting to hear more about the resources that are available, maybe beyond just the obvious. Those are the big talking points for me in terms of the work I've been doing. I also have a handout which is up there. At the beginning of April, there is a summit in Georgia called the RX and Illicit Drug Summit. In the weekly or more monthly meetings that I attend with coordinators or directors of respective state councils, many of those members will be attending, and there are a number of breakout sessions specifically dedicated to the opioid settlement dollars. And I think it would be a really great opportunity to not only meet my counterparts in other states, but to have those discussions in person and bring that back to the council. The proposal that I've created with the conference registration fee, you can get on-demand access to all of the breakout sessions, and I think the keynote speakers as well, for 3 months. So that could be something the council can have access to, as well as internally in the AG's office. I don't know if anyone has any questions about that right now. In the budget breakdown, I included the registration fee, accommodation, and transportation. As an independent contractor, I did not include meals, but that was the only expense that was not included.
So, Gordon?
Well, because that's coming right up, I'd be prepared to move that we authorize the chair to work with Mary to attend the RX Summit. And I'll speak to my motion if somebody says.
I'll second.
I went to this conference last year and gave a talk, and this year Dr. Steele and I are doing a poster session on the 1,000 Lives campaign. There'll be at least 2 state people going, and then I know there's some other people from Maine going. I don't like the conference fee. I don't like the fact that it's a very commercial thing, but all the federal people go. And it's a terrific, the content is terrific. And even if 12 of us went, you can't cover all the 90 sessions. And it's great to pay the extra to be able to watch any of them for the next 3 months, I think. So I think it would be highly beneficial for Mary to go if she's able to take the time. It's about a 3-day conference, so I'll make that motion.
So it's been moved and seconded. Gordon, thank you for the comment. I can tell you that I just think it'd be so beneficial for Mary to be there, which is why I said to her that she needed to bring it to the council for a vote. Other comments, questions about sending Mary to the national conference?
I'm supportive as well, but I think we discussed, correct me if I'm wrong, of like administrative costs like this as possibly being expedited review through the executive committee as well as if we didn't have this meeting. I just want to make sure that we have, making sure that I'm missing out on opportunities that just because of the procedures of the council here.
I think it's probably one of the things we need to discuss at the executive level about what monies or how much people are comfortable with approving that on an executive committee level. But we'll certainly put that on for a topic because, some things you need to move quickly on, and there really isn't any guideline right now that says how much, so we can make that guideline and be able to do that. Thanks, Ben. Any other comments? If not, can you call a roll?
Liz Blackmore?
Yes.
Todd Brackett?
Yes.
Lydia Krebs?
Yes.
Joe Everett?
Yes.
Betsy Fitzgerald?
Yes.
Courtney Gary Allen? Pat Kimball?
Yes.
Ben Mann?
Yes.
Bruce Nodden?
Yes.
Miles Alec?
Yes.
Eric Small?
Yes.
Gordon Smith?
Yes.
Keena Thackrar? Trustee Tool?
Yes.
And Paul Vinsel.
Yes.
That's 13.
All right. All in favor, motion carried. Thank you very much. And we look forward to hearing from all your learning in Georgia, so. Yeah, it's in there. Oranges. Georgia peach. Bring some peaches back. All right, so thank you very much. So this is the educational piece that we and the first person to ask is Greg Payne, who's here with us from the, make sure I get this, from the he's a senior advisor on housing policy at the Governor's Office of Policy Innovation in the Future. But he's here today to actually talk about low barrier shelters and the work that he's doing on that committee. And I've asked him if he'd come up and sort of sit with us here rather than sit back there, so people on the Zoom can hear him.
Any preference for where I go? Is here fine? Is it all the same?
Probably if you sit right here, I think they'll be able to see you on the Zoom.
Okay. I have a handout here.
Do you want the memo projected up here?
Oh, yeah, sure, we could do that. As long as somebody keeps track of if they have questions.
Let you have your space.
Thank you. Yeah.
We got, thanks.
Well, good afternoon. My name is Greg Payne, and I serve as the Senior Advisor on Housing Policy in the Governor's Office of Policy Innovation and the Future. I really appreciate your willingness to put some time on today's agenda for this conversation and hope you find it useful as you continue with the important work in front of you. I asked for an opportunity to talk with you because we have a serious problem to deal with and hope that the council will consider being part of the team needed to solve it. I'm going to take about 10 minutes to walk through this memo that I provided and then hope to just have a conversation and answer any questions that you might have. As some of you may know, there are about 40 shelters throughout the state that participate in the Emergency Shelter and Housing Assistance Program, otherwise known as ESHAP, at Maine Housing. Within that group of 40 shelters are 5 privately operated low barrier shelters with an aggregate total of 234 beds, which generally serve those with the greatest challenges, including substance use disorder, acute mental illness, and serious physical health problems. These shelters are deemed to be low barrier because they do not require any of the following to provide assistance to those in need: criminal background checks, credit checks or income verification, previous participation in programs, sobriety, or identification. Beyond providing a safe place to be, the low barrier shelters provide a broad range of supports for those they serve, including harm reduction, overdose reversals on a far too regular basis, connections to Medicaid-assisted treatment, handoffs to recovery services, connections to medical and mental health providers, and housing navigation. They also provide the stability and community that is so often needed to allow individuals to successfully access ongoing treatment and substance use counseling. Low barrier shelters reduce the intense daily stress of living unsheltered, putting their clients in a position to begin exploring pathways to recovery from substance use disorder and other challenges. The low barrier shelters tend to struggle the most to meet their annual budgets for a few reasons. First, they don't have access to any particularized funding sources that target their clientele. Second, the cost per night of providing shelter to this challenged population is typically higher than it is for others who need shelter, given the need for additional services and case management. And third, private fundraising is more difficult for them than it is for shelters that are serving other populations, such as families with children. These challenges have led to an aggregate $3.9 million structural funding gap for these 5 low barrier shelters, which now threatens their continued viability and risks a significant increase in unsheltered homelessness in several Maine communities. The board of directors of Hope House in Bangor, as some of you may be aware, which currently provides 56 desperately needed shelter beds there, has already voted to close that shelter this fall, unless another organization can step in before them to take over operations. Obviously, having anybody take over those operations without a clear path to fiscal sustainability is unlikely to happen. Likewise, Mid-Maine Homeless Shelter in Waterville expects by this summer to run out of the funds necessary to sustain the 62 shelter beds it now provides to those in need there. The other low barrier shelters have made clear that they are not far behind. The individuals utilizing low barrier shelters tend to experience homelessness for longer periods of time, and Housing First initiatives with significant support services in place are often their most promising permanent housing solution. However, funding for the state's new Housing First program does not start until July of next year, and it will take some time before new Housing First properties are built in various parts of the state. So until then, there is likely to continue to be a great need for the key supports that low barrier emergency shelters provide. My office has been closely engaged on this issue since last fall because we're committed to ensuring that all those experiencing homelessness in Maine have a safe place to be, as well as a means by which to connect to the services they need to gain stability. Likewise, the legislature's Joint Select Committee on Housing has been focused on this issue for many months and has unanimously, across party lines, joined Governor Mills in calling for $2.5 million in new investments to ensure that Maine's low barrier shelters remain open and fiscally sound. Those recommendations are now being considered by the Appropriations Committee as part of their negotiations on the supplemental budget. We have also been in conversations with the Attorney General about the use of opioid settlement funds being administered by his office to address this problem. He's very much aware of the close nexus between the approved uses of those settlement funds and the life-saving frontline work of Maine's low barrier shelters, and is actively evaluating the available funds he may have remaining to help solve this problem. Additionally, the low barrier shelters themselves have reached out to their local, municipal, and county jurisdictions, which, as you know, are also administering opioid settlement funds, and are requesting their participation in the effort to keep these shelters open for those struggling through the nightmare of homelessness, addiction, and mental illness. We need the Maine Recovery Council to be part of this team. No one level of government should be expected to solve this problem by itself, nor can we realistically expect the private sector to do so on its own. But working together, the governor, legislature, attorney general, local and county governments, private donors, and the Maine Recovery Council can and must ensure the viability of Maine's low barrier shelter network. We know from painful experience that if this resource ceases to exist, too many of those in need will live unsheltered outside. Their conditions will deteriorate, and the results will be highly detrimental to both the individuals themselves and the communities in which they live. We're aware that the council is not currently accepting applications for funding, as you're establishing a process by which to receive such requests. We respect that process and are not asking for a disbursement of settlement funds at this time. Rather, we want to make you aware of the serious problem that directly relates to your work in addressing Maine's opioid crisis and seek your partnership in solving it. We also want you to be aware that if the council does ultimately decide to be a part of this effort, Maine Housing can and is willing to perform all of the administrative work required to deliver any allocated settlement funds to the low barrier shelters, as well as provide the necessary oversight for their expenditure. I've included information about the revenues, expenses, and net operating losses at the 5 privately operated low barrier shelters to this memo. I really do appreciate your consideration and your hard work in supporting Maine people who are struggling through the extraordinary pain of opioid use disorder. And we look forward to working with you in the weeks and months ahead. So I hope the information in the memo and the attachment is helpful, both now and as you have any further conversations in the future, and really appreciate the chance to have this conversation. I'm happy to answer any questions you might have.
Paul?
Thank you very much. This is excellent. And really, you talk about what we're looking for, which is a partnership with the state government, local and counties using their settlement funds as well as ours. Of this $3.9 million deficit operating aggregate.
Yeah.
What
percentage of that do you estimate would be needed after legislation, the Attorney General's part of the settlement funds, and the local and county governments part of the settlement funds?
Yes, some of this is a little bit of conjecture. Certainly, there seems to be consensus between the governor's office and the housing committee about $2.5 million. We'll have to see if that survives the appropriations process, but I'm fairly optimistic that it will. Beyond that, the Attorney General isn't yet in a position to say how much money he can allocate. I get the impression that he's close to being able to determine that. I think he's trying to understand some of the funds that haven't been received yet in order to make a final decision on that. But I know that he doesn't have as much funds at his disposal as the Maine Recovery Council does. I guess I would think that as the Housing Committee, I think, had asked something in the range of $500,000 a year for 3 years, or $750,000 a year for 3 years, or something along those lines. I can't remember the specific ask that they made of the council, but I think between the Attorney General and something in that range and the additional, probably the lesser supports that the counties and cities can provide, I think we can get there. And I also think that these shelters are used to being pretty good at asking for private support as well. So, I think that between all of that, I think we can get to 3.9. I hope that that's helpful.
You must have one.
Other questions?
I'm sorry, I have a number of questions. And I know this may be a little too granular, but Hope House, does that mean that only the side that is the low barrier shelter will be shutting
Yes,
down,
yes.
not the medical center, not the dorm side? Okay. And then, does this, or has there been any planning that has included input from the statewide homeless council? Because I know they've been doing a lot of work over the last 2 or 3 years as it pertains to housing in the community, but also low barrier shelters, and I'm just wondering if there's been any communication with that.
Yeah, quite a deal. Actually, Gordon and I both speak on a regular basis with the statewide homeless council, and actually that was just 2 days ago that we last spoke with them and talked about this very issue, and they understand that this is sort of an existential threat to this important resource, and they're very supportive of this conversation.
And I was just making sure that we're all
working
together. Thanks, Greg.
Yeah.
Great, thank you, Lydia Crafts. I was just wondering, some of the funds here listed don't indicate reimbursement from Maine Care, and I'm just curious what portion of funds, if you know, are reimbursable services at the shelters?
I don't. I think that we need the directors of any of those shelters to, I'm afraid I'd get quickly into trouble trying to.
Yeah, no worries, okay.
Would you like them to get that number for you? Representative Kraft?
No.
Okay.
Thank you.
Greg, correct me if I'm wrong. You were with me, I think, when we toured Elena's Way, and we asked that question about their annual income and how much could be billed to Maine Care. And it's very little. I mean, it's almost a negligible amount, and it's not that surprising when you're not really providing a medical service so much as providing shelter. So, I mean, it's an absolute right question to ask Representative Kraft, but I don't think you'll find much satisfaction that that's where this is going to come from.
I don't think you can bill Maine Care for room and board, and that's basically what you're doing. So I know in residential programs, even with, you can bill for the services, but you can't bill for room and board. And what the shelters do is basically room and board.
Thanks so much for providing us this information. I'm curious, So I see this is sort of the budget is this like today's deficit?
Yes.
And then I'm wondering if there's been like projections of the future and some sort of thoughts about how we would also think about this in even a 2-year, 3-year, and just thinking about what could be some of the, expectations of the Recovery Council on supporting efforts kind of over a longer period than 1 year. We will vote, I'm sure, in 2 year, probably 1 or 2 year increments, but I guess I'm just curious of what, are we thinking this is like every year we're sort of gonna be in the same place because of just where we are right now with people's needs?
Yeah. I mean, I would assume for one that the 3.9 million that is currently the aggregate deficit will grow over time the way it has over recent years. And I do want to be specific, I probably wasn't specific enough with this memo, that in reference to the Housing First initiative, the idea here is that Housing First, which is this massive undertaking that is going to lift off over the course of the next year and a half, until we get there, we're going to need to support the shelters in an ongoing way. And to your question, it's a great question, our hope and the whole point of the Housing First initiative is that it's not forever, that Housing First will become the permanent housing solution for folks. The idea here is that if all these partners can come together over the next few years to bridge to Housing First, that would, that's specifically what I'm hoping we can all come to some partnership on eventually.
So I can share with you, Liz, in January, we received a letter requesting funds from them, and I told them, and what they requested was 1.5 million, 1 million to 1.5 million for the next 3 years. Per year for the next 3 years. Yeah. But that request may change when an application comes out and they actually do it, but that's what the original letter from January that they submitted said. Thanks. Paul?
I have another question. Ben maybe will help with this. In one of the last paragraphs, you said Maine Housing can and is willing to perform all the administrative work required to deliver the allocated funds to the shelters. We've struggled. We had thought that we would be able to give some money to the state and they could allocate it to some of the other things that we've already approved. And that doesn't work out. Yeah. I would assume that would be the same with this, that we can't just give Maine Housing the money and, we can't just transfer it to them.
Ben, do you know that answer? Is Maine State Housing the same as
I believe that's right. I don't think the Recovery Council can transfer funding to Maine State Housing.
I guess I would ask that get investigated, because one of the great joys I've learned in my first role in state government is that Maine Housing being a quasi is a blessing in many ways. And I just do wonder and just ask that we look into this, because the bureaucratic requirements on most state agencies don't necessarily apply to Maine Housing, which is why money can get out the door really quick. So if in fact we find that it does not have the same limitations that a state agency, which it is not, does, I think the thing I just wanted to make the council aware of is that I know that process is painful. And if we can find a way to get there, Maine Housing can sort of take that pain completely away.
And it's not really the state that has the requirement. It's the way the statute and the MOUs said how we can allocate money.
Yeah.
It's really sort of this glitch we ran into that we went, oh. So, but we, it may be worth looking into.
Yeah, it's both sides. I'm happy Gregor, I can follow up with Maine State Housing.
Excellent, thank you. Todd, you had your hand up.
Yeah, can you help me, can somebody help me understand, so the amounts that we see in these budgets from Maine Housing, whatever the acronym is there, is that the amount that the state is investing in these shelters today? Aside from the 2.5 million that you referenced in the note that the governor's asking for in the supplemental?
Yes. So right now, so when you see for each of these shelters under revenue, There are, Maine Housing eShop is, code for 3 different funding sources that come into Maine Housing. They sort of are a funnel for 3 different sources. One of those is a ongoing annual appropriation through the state right now. It's $2.5 million. That's just a line item in the budget that hasn't changed since 2017, which is part of the problem. But what happens is the $2.5 million from that line item, as well as some federal funding and some home funds from Maine Housing, those 3 things make up eShop. And so when you see, like in Elena's Way, the top line Maine Housing eShop of 191,000, that is some of that 191, not all of it, but most of that 191 is functionally coming from state government already.
Thank you.
Sure.
Ben?
Thanks for talking to us today, Greg. I just have a couple questions. It's sort of related to Liz's question, has the operating deficit of low barrier shelters just been grown? Like what has changed over time, or have they been making ends meet and they have reached a point where they need, like what has changed over time that is sort of making it a crisis today?
Yeah, I think that for all of the shelters, even outside of low barrier shelters, there's been the kind of ongoing issue in the world of just everything costs more. And when your sources aren't being adjusted in order to meet those increased costs, there's obviously a problem. So kind of all shelters are struggling with that. But I think above and beyond that, the big critical issue here is that the rise of opioid use disorder and the increase in unsheltered homelessness has caused these low barrier shelters to need to hire the additional staff required to serve them. And beyond having the need to have additional staff beyond what other shelters have because of the nature of the struggles people are having, they need those staff to be having received greater training. And just so their costs have accelerated beyond even the regular shelter's costs for that specific reason.
And I can share with you, I just got off a shelter board. It's not a low barrier shelter, but the cost, the increase of people that they serve, and the increased cost in training, and the increase that as wages went up in order to get people to do this very difficult work, they had to really increase the rate of pay that they were paying people because they were losing them. All of those added costs just led to more and more money needing to be there. So I know that that's part of, again, this is just a small shelter I was part of. Ben, another question?
Yes, just 2 more quick on numbers, just so we can make sure I'm tracking here. Maybe I should know this. Is the 2.5 million in the governor's budget, or is that a bill on the table?
It is included in the governor's budget, specifically within the 16 million she requested for the emergency housing relief fund.
So that's one-time funding, not ongoing?
Right now, that is. The housing committee has taken that and suggested it be ongoing. And so I suspect that is going to be very much a conversation going forward between appropriations and the governor's office.
Okay, and then, so, just for the benefit of the council, it looks like if there's an operating deficit of 4 million, and that's annually, we're looking for, so, and that leaves a $1.5 million gap for fully funding that, and then there's various different sources that we listed, so I just want, it sounds, I mean, we have exactly twice as much money as the Attorney General's shop. We get 50% of the settlement, and the Attorney General's shop gets 25%, so just for context. 20, excuse me, yes, that's right, 30% municipalities.
Yeah, and I'm kind of sensitive to I didn't want to come in here and make a specific ask for the specific number, because I don't get the impression you all are in a place right now to hear that. But I will say, I think we're close, like I mentioned with the Attorney General, getting his decision on what he can do. I think that I'm happy to follow up with Pat or however the best way is to communicate after I hear from him. And we'll see what gap we have remaining at that point. And I think that'll help answer that question.
just my final question also related to numbers, the cost per bed varies significantly across these shelters, for like 3x. The cheapest one is, the least expensive one is 17,000, the most expensive one is over 50,000. I would think just conceptually the cost to operate shelters would be similar across this. Any thoughts on the different operating costs?
I mean, I can ask them about that. I suspect that ultimately it has to do with the range of services being offered at each individual shelter. I could ask them to delineate that a little bit more, if that's helpful.
Any other questions? Was anyone on the Zoom that had a question? Because I can't see. Oh, there it is.
No one's raised their hand.
Okay, no one did. All right. Well, thank you very much.
I just have a question around unique participants, like how many people are accessing beds on an annual basis, so we have a sense of what the larger numbers are.
Yeah, that is absolutely gettable, and so I'll do that. Right, because it's a very good point that even though we're talking about 234 beds, there's far more than 234 human lives who end up using those beds, and I can get from all of them their, say calendar year 2023 aggregate count.
And I'm curious if that also then carries over to Ben's question in costs associated if you have much higher turnover, if that changes the cost per bed.
Yeah.
Paul?
Sorry, one more question though. Do you have any data on what percentage of people that utilize the low barrier beds actually seek recovery treatment?
Are you asking seek it as opposed to having substance use disorder?
No. Yes, as opposed to having substance use disorder, but one of the things you put in here is that that is one of the reasons for the higher cost of a low barrier is that referral and connections with medicated assisted treatment and hands-off to recovery services. I'm just wondering if there's any data to what percentage of the clients that utilize your services actually seek out those two, medically assisted treatment or recovery services?
Great, I can ask that question. I mean, and I know this isn't exactly what you're asking, but for example, when Gordon and I went and visited Elena's Way, we asked the question out of the, I think at the time 35 people we're looking at here who are utilizing this low barrier shelter, how many are struggling with substance use disorder? The answer was every single one. The majority of which is specifically dealing with opiates. But the question about how many of them are actively seeking recovery, medically assisted treatment and the like, I can absolutely ask that question and follow up.
Thanks.
Thank you.
The memo describes the communications and outreach with different entities and different elected officials, and it describes the shelters themselves having outreach with their local municipal and county jurisdictions. Are you involved in those conversations?
I am not. I kind of just felt like it was probably better for them to be reaching out than for somebody at the state level to be reaching out. I think that their requests have met different levels of response, kind of veering all the way from we didn't know we had opioid settlement funds to yes we do and here's a pot you should apply for. And so I think folks are working through those responses. I think once they get to the point of kind of having some connection with each of those jurisdictions, I have sort of made it clear I'm willing to make myself available if folks think that's helpful. But I'm also conscious of being a state level participant in these conversations, and sometimes that's more unhelpful than it is helpful.
I'll just say from I'm in Cumberland County and 3 of the 5 are in Cumberland County. And we have just put out an RFP, but it's for $80,000 for 1 year. So just like because we only we allocated ours to a few other things, coordination, and so there still is municipalities that have funding that they may seek out support from those municipalities, but realistically, the max that would be available in a year if they were chosen is $80,000 for the 3. So it's a limited amount.
Yeah, it's not a lot.
So I guess the follow-up is, you described this sort of conversation that the council will be part of a group of entities that figure out how to bridge this gap. To the extent that that the subdivisions are meant to be feathered into that consideration, it sounds like either they or we need to engage directly rather than waiting on or getting guidance from anybody else.
Yeah, I mean, I guess what I'd say is, first, they've all made outreach to both their cities and counties. And like I said, I think the difference between Cumberland County's response and some others were quite different. But I think that it would be enormously helpful for the Maine Recovery Council to signal some interest in partnering to them as well. And to the degree that can happen, I suspect it might help bring in participation that might otherwise not happen, if that's useful. And I will say, I'm totally happy to help coordinate some of that and outreach to them if folks would prefer. I can do some wrangling, but I just think between the shelters themselves and the members of the Maine Recovery Council, I think that both of those groups are better positioned to have impact with those jurisdictions than I am.
All right.
I'm sorry.
One more.
I'm sorry. Do you foresee a path forward here by which the council can fund programs and services, specific programs and services rather than here's funding for the shelter as a whole?
Sure. I mean, I think to the degree that's necessary, like in terms of complying with settlement uses, I would think that, the state money, for example, probably does not need to be that specific. And so I would imagine if that's necessary, there's got to be a way to accomplish that.
Thank you.
Thank you very much. You've certainly given us some food for thought as we move forward. We're very grateful that you reached out your hand and said you'll help us. I know that Mary, we're sort of focused on this application process right now, but I know Mary has reached out to the municipalities and will continue to do that, but certainly will, if we need some help, do that. And thank you very much. It was very informative.
Yeah, thank you again for your time. I know you're doing a lot. You have a lot of different requests and things you're trying to do. Again, to the degree I can be helpful on this one piece of it, I'm here and happy to do so.
As we said, we know it's a huge, important issue. And a lot of the people that are in those shelters are people that are alone and that are dying. And so it's an important piece of support.
Yes, thank you.
Thank you very much. Thank you.
Thank you very much.
Thanks.
Thank you. All right. Next on the agenda, thanks, Greg. Next on the agenda is, if you remember right, when we voted in the almost $9 million to fund some programs, we also voted in on having a subgroup to help us with some technical assistance in regard to prevention. And Scott Gagnon is here today to share with us what that plan looks like. Hi, Scott, how are you?
Hi.
Come join us, please, because we don't want you way back in the corner.
I do have a good dad voice, but we'll do it from here. All right, so first of all, I know I briefly described, let me introduce myself. So Scott, my name is Scott Donier. I do say hello differently because I'm from the county. Originally from the county. I'm not from that part of the and my main job is director at Care Educational Student Maine, where we house the New England Prevention Technology Transfer Center. Would it be helpful for me to give like a 3-minute, 2-minute spiel of what that is? Okay. So I did briefly describe it. So the PTDC, as we fondly call it, is, it's actually a SAMHSA funded federal, technical assistance program for prevention. So there's 10 regional PTDCs, so we're one of 10 centers that covers the country. So our region is New England, so Maine, New Hampshire, Vermont, Mass, Connecticut, and Rhode Island. And our charge from SAMHSA is to ensure, or to help ensure that basically science gets into service, so that all prevention programs are informed by prevention science. The cool thing about this program is it's a little bit of a sandbox for us, and that basically our main job is to respond to what the field needs. Now, SAMHSA's view of this is pretty broad. It's really anyone who's in the business of doing prevention. Now, granted, one of our biggest sort of consumers of our services is the prevention workforce and prevention coordinators at state and federally funded coalitions. But really, any entity that's in the business of prevention can seek our services. So the Maine Recovery Council certainly is one of those entities. And I remember at the hearing, I think I threw out, I think this was where the start, I threw out that we could provide TA. And so what I've, with that request, what I've presented to you here is sort of just an idea of how we could provide technical assistance to this group. And it is an idea that's obviously very open to molding. As I mentioned, this program is a little bit of a sandbox. So SAMHSA gives us great latitude in how we shape and respond to things. So this is not written in stone by any means, but just sort of a first thought. So essentially what we're proposing here is more of a structure than anything else. Structure and some research staffing, really. And we've done a little bit of this in some other states. So one of the most recent projects that's somewhat similar to this was supporting the state of Vermont that wanted to come up with a prevention workforce development strategic plan. And so we basically came up with a structure of how to convene people to talk through the priorities and come up with a plan. Now that we did that one in one day, so it's a little bit different in that sense. But that's essentially what I put forward here is a structure that we can provide to help convene and facilitate a process by which a work group that consists of, I guess, folks from the council and other folks that are invited to join, to go through a deliberative process to make some kind of recommendation. Now, we certainly would seek guidance from the council on what they want the end product to be. Is it specific programs? Is it categories of programs? I mean, we would want some guidance around what you want the end product to be. I guess it sounds like you're talking about an application process. So one end product could be like some themes you want to prioritize for prevention applications. The end product can be whatever you want it to be. But basically what we're proposing is just a structure that we can provide to help walk through and get you there. So a work group, and these categories I pulled from the exhibits. These types of folks you could have on the work group. It's just suggestions if there's other folks you'd rather have on here. And that certainly could be very pliable. So that's basically what we're proposing. I know there was a question on here as well about what types of information we could collect. We are fortunate at AdCare, we are also the prevention training and technical assistance provider for the state of Maine, so we work very closely with Maine CDC. So we would have access to their strategic plan. Obviously, we have our own work that we do and some other places that we could pull from. The governor's plan, obviously, around prevention. So we could pull that together as sort of a starting point to examine what some of the gaps may be in terms of what's not being funded or prioritized. And then there was a question about the roles of the work group. And again, we see ourselves as the convener and some additional support. As a federally SAMHSA funded project, we don't want to get in the business of making any recommendations. But I see what our role would be is, as you're going through deliberations, like, oh, we need some more information on school-based programs or information on early programs for early childhood. Like, we can do that work. We can do the research, pull together some examples, do lit reviews, whatever is needed. So yeah, we don't want to make any recommendations. We definitely don't want to be part of that. We just kind of help provide that structure and TA support, research support to help guide the deliberations. And then I put a proposed timeline. The note I would put around this, again, this is just a first idea, just as a little bit of background, that we are in the final year of our funding from SAMHSA for this cycle. We are currently, I'll be doing this when I go back to my office, resuming grant writing for the next round, which would start September 30th. So that's part of what's informing this timeline. So what I know is we're funded for sure through September 29th, 2024. I have a strong feeling that we'll submit a good application, and SAMHSA hopefully will pick us again to serve New England. And so certainly that work could, if we are refunded, the timeline could go beyond September of your timeline. If you need more, if you wanted us to go longer or whatever. So, that's kind of the pitch or the first idea of what we could provide, and open to questions or thoughts or other ideas.
Questions, thoughts? I don't see any hands online. So I have a question. So the subgroup would sort of look at and not make recommendations, but sort of share with us different prevention programs that we could possibly fund, or what we would be looking for in applications.
If that's what you want. I mean, that's what, I'll clarify. I think the work group could make recommendations, just PTC staff, so myself and my staff that would staff this would not want to, we would not want to make recommendations as SAMHSA funded people. But I'd say the work group members would be outside of us. Certainly, I mean, if you want, if that's what you want, certainly could be. But I just, myself and our staff, we wouldn't be trying to push certain ideas just because of the being federally funded. We don't feel that would be appropriate for us to do that. But certainly the work group itself could do that. But I think the end product would be whatever you want. If you want specific programs, or you want, again, categories of programs or ideas of types of prevention initiatives to prioritize, whatever you want the end product to be, like that's what we'll aim for. I mean, I don't feel like I'm in a good position to tell you what it should be, but whatever you want it to be, our role is to inform it with prevention science to make sure whatever the recommendations are, if it's categories, if it's specific programs, you can feel assured that everything on that list, whatever it is backed by science and evidence.
And this committee would be formed of different individuals, but some members of the council who chose to be part of that.
I think it would be ideal if you had at least a couple of people from the council to have that connection, yeah.
Okay, thank you.
Yeah, I guess I think when I suggested this as a possibility, I think what I was thinking about is that there's really only one person on the council who's done prevention and works in prevention, and I think that prevention is very wide and broad of what can be a part of prevention, and there is a lot happening out in the state. There's a lot that the state is funding. There are people who are federally funded. There's work that's happening in schools, and it seemed like a good opportunity to have people come together that aren't on this council, but that could be informing it, because I essentially was going around and asking everybody that I know in prevention, what do you think should be prioritized? Because there's a lot happening across the state. And so it's not to say that I mind doing that, but I think it behooves all of us to hear from those people directly through a work group, to be able to have them be a part of a work group that I would happily be a part of. I could be the chair of if that made sense for me to be the chair of it and be that connection, but have that group do the work and be able to access PTTC's staff, or finding out what's getting funded already, put it together. What are some things, like if we really want to do, if the council wants to do school-based work, or we want to do community-based work, let's go find out what are the top options for doing that work that we can fund. So I think that was my thinking behind this, and I think, I guess I'll just say, Scott, thank you for putting this together, and I see where we could go in some other different directions, and I appreciate all that you have here. I guess my only thing with the work group structure is that you have 4 folks on here who are all kind of, I would say, are like treatment providers. I would prefer that we do more on the upstream, because we have lots of those folks represented, and a lot of those, I think it's like youth serving organizations, or some other folks who are perhaps working in the juvenile justice space where they're really interacting with young people who are, there could be some early interventions, like sort of later prevention work that could be done in that space that isn't represented and we aren't really hearing from, that I think, and perhaps some folks who are doing work with families, because I think that's another space that is like that upstream work that I think could really be helpful for providing some more thoughts about the like sort of breadth of prevention efforts that could be funded.
Oh, yeah,
through
totally.
council.
This was just sort of an idea.
Yeah.
And honestly, I'll be honest, I put this together about 3 months ago, and I know I pulled it from the exhibits, and I can't exactly remember why, like how I got to those bullet points. But yeah, this is definitely very, very, whatever the council would want to guide us on.
Yeah, so I guess I'm saying that's who I would like to suggest to the council that we add for folks on the council, on the work group. Thank you.
Sure. And I put on there like a suggested size, and part of that is just to make sure that work group, so I'm sure you all have had this experiences when you have too many people on a thing, it makes it difficult, but if you don't have enough people and two people are not always attending meetings, that make it difficult. So hopefully 8 to 12 is a nice sweet spot between not being too many, but having enough that if people get sick or whatever, we have enough different perspectives at the table at all times to make sure it's well-rounded. Because I think, it's informed by prevention science is important, but also, like you said, prevention is wide. And so there's lots of people who do prevention may not think they're doing prevention, and having their perspective at the table is really important. So.
Excellent. Bruce, you had a question.
Just a broad question. Does this apply to guidance for the funding that we've already approved, or guidance for maybe future spending for prevention? I think so.
Yeah, I mean, I think we already did the stuff we approved, like I think that's already done. I was thinking this would be like for future, which is why the timeline sort of is okay that it's longer, because it allows us to do some like forward thinking about what do we want to fund.
But it wouldn't really have anything to do with what we've already approved.
It won't have anything to do with it.
Yeah, no.
That's been promised.
Yeah.
So, yeah.
Yeah, I wouldn't feel comfortable being involved in that anyway.
But I'm just saying, I don't know, that it would all fit into the bigger picture, I guess, that's what I'm thinking.
Yeah.
But I'm just asking a question, I'm not making any recommendations.
I think that we already approved that, so that's already done, but I think this would be for future.
Yeah, and I sort of look at it, I'm trying to look at the time frame, and where I'm struggling a little bit is that I know we're getting ready, to launch this application. And so, but again, we also know that this money is here for 20 years. So, and we're certainly not going to promise in this round of application 20 years of funding. So again, I think the time frame works, but I'm trying to figure it all out in regards to applications.
We already have things on our
correct
priority list that we may want to do. I also think, I'm in public health, I think long-term. So I think like having us doing this work now sets us up for having future.
I think so.
Informed conversation.
But I will just throw out and volunteer that if there is anything we can provide for support for this next early round, obviously not this, but like if you're like, we want to prioritize this, what can you tell, like what can you gather for information or research, like we can, something we can do.
Great. So, Paul?
So just logistics wise, so the Recovery Council would contract with NEPTTC to form this group, and then the group would inform the Recovery Council on priorities.
You wouldn't need a contract with it. So as a SAMHSA funded TA center, like you've already submitted a request, so, and our services are free.
Okay.
Right.
Your taxpayer dollars.
All right.
So.
Free is always good.
So, and that's something I'll throw, I know I mentioned the last presenter talked about training. I just want to throw that out there just as a general thing. If you come across things where, some training resources are needed, go to SAMHSA's website. I can tell you they fund an alphabet of TA centers. We're one of 100, and I don't think I'm exaggerating, TA centers that SAMHSA funds. So, no, our services are completely free. So no contract needed. You've already submitted a request to us. So this is just a pitch of how we could address that, but definitely we can roll it out. And no contract needed.
That's right.
I really like this idea. Thank you for presenting this. My only concern, or what I want some reassurances, is that we're not creating a new process for this new group to have to establish rules and procedures, like that this group would have very flexible, quick moving, like that we wouldn't be bogged down in the same way that the council has been. So I don't know if anyone can give me that reassurance.
So what it is the council developing a subgroup, so they're making recommendations towards us, and I don't think, okay, here we go, that they have to be public meetings, I don't know.
Well, council members.
I mean, can we,
Hold on that one thing?
Yeah.
Okay, well, we'll research that, but for the most part, it's the council just partnering with prevention experts to share with us what's available, and the council makes decisions. So it's not, again, it's part of the council. It's probably not, it's shorter termed. It's not gonna last for, we may use the same process again, but again, it's for them to produce and to share with us their thoughts on what they think the most, again, with my words, not anybody else's, but the most effective use of prevention dollars in regards to the state and how we spend our money.
Thanks for your talking with us today. I just, it seems like to me, correct me if I'm wrong, it seems like there's two distinct things here. Like we can work with you for technical assistance for basically an assessment of what's going on in Maine. And then there's also a work group. I don't think they're necessarily connected, they can be, but it seems like we're gonna have other things. I don't know if we want a work group for every pillar for opioid response or defer to the council on that. But it also seems like the assessment piece here on the backside is different from the work group structure and the representative roles, and they're not necessarily inextricably linked.
Yeah, I mean, I was just kind of responding to this question, so I was running on the assumption that this information was wanted as part of the work group. So, I mean, if that's not needed, we can just go right into convening the work group and doing deliberations. We don't have to do this assessment piece, but I was just responding to this question about asking about information we could collect. So if the work group wanted this kind of information collected, we can do that. If it doesn't mean that we don't have to do it either, so.
Well, it's actually sort of the opposite, just my view. I think I would be interested in getting the assessment done on what's going on, like, now, and then we can deliberate and figure out the work group, which I think the assessment is a standalone thing, a snapshot of what's going on in the state right now. The work group, like to Liz's point again, is sort of a long-term investment so that we can be better informed about getting smarter on some of this stuff and making sure we have the best advice coming in and priorities and gaps and everything, even though the assessment would probably provide a gap analysis.
Oh, okay, I see what you're saying,
Yeah.
I mean, yeah, we could approach it that way, too.
Gordon and then Liz.
Yeah, I think it's a good idea. It's very similar to what we did in this room back in 2019 when we put together Executive Order 2. It's actually easier to do treatment, harm reduction, recovery, support, frankly. I mean, that was our feeling, and I still feel that way. I mean, there's some clear things that you can do that are evidence-based. When you start going upstream, that Liz is talking so much about, and talk about primary and secondary prevention, it's much harder. There's a lot more options, and of course it takes a long time to see the results. So we decided, Mary Herman and I, and we bring, Liz probably came to some of the meetings, we were in this room until the pandemic. Penda Macon chaired the group. We'd have like 40 people in this room. And we met for a year and the mission was to find the best curriculum, the best practices. And we met for a year, and we still didn't really. We learned a lot. And so I think this is much the same, that it allows us to step back and say, well, let's get some help on this, because only one of us really, is professionally trained as a certified prevention specialist. So I think this makes a great deal of sense for those reasons. The one thing we haven't really talked about, I don't think, it is who's going to appoint the people of the work group, because if they're gonna be like our grants committee almost and make recommendations to us and use outside people too, that's a pretty big deal. And so I just wanna know, I don't have a strong feeling about it, but either of those appointments need to be made by the chair, the executive committee, or the council. I mean, we haven't, it's not in these 2 pages, and that's the only question I have.
Yeah, I would defer to the council now. Like, again, it's assuming you still want to do work. I mean, we discussed, if you'd rather us just focus on this assessment piece, we can do that. We don't need to do, like, again, whatever you want us to do, we'll do.
So I think at this point, in my head, and people certainly can have a discussion about this, I would like to, chair, because I can do that, appoint subcommittees. I would like to appoint Liz to chair that out. And she can go out, find some council members that want to be part of it. And then I think that she can give a recommendation up to who she thinks should be on that subcommittee. And we can take that, rather than wait for a full board, we can always take it to the executive committee to have a short look at that and go from there. But I think for time and expediting it, I think, Liz, if you would do that honor of chairing that subcommittee, and people can volunteer with Liz or email her in regards to who won. But again, you're going to limit it because we don't want it to be overwhelming. And then you can make a recommendation to the executive committee and we can vote on that. Does that sound like a reasonable plan?
Could we simultaneously ask the PTTC to put together the assessment so that when that subgroup gets together, they have that assessment to then add to and feed?
Yeah, we can do that.
That sounds great. Yep. Thank you, Lydia. So
we already have a plan. So if there's no objections to that, I don't think we need to vote. I think as long as we have a consensus of everyone here and on Zoom, we can move forward with that. And Liz, thank you very much for stepping forward and doing that. And Scott, thank you for coming here and sharing this with us and helping us, again, because we want to be able to invest our money well.
I'm just wondering a timeline for that assessment, when we might anticipate having information.
Well, so I guess, and I don't know if what I put in here for the assessment, does that look like what you're looking for? I mean, I would like maybe a little bit more specific items on what you want in the assessment. Is it sort of what's being funded so far? Because that was kind of the gist of what I put in here, is like look at a sort of landscape of what's already being funded through different means and pulling that together. Is there other data you want? And that's, I guess it depends on the scope of what type of information.
I would suggest that the council give that conversation to you and Liz to have.
Okay.
Guide, unless anyone has more specifics.
Yeah, if folks have specific things they would like to add, I was thinking that like a landscape sort of assessment would be really helpful.
Okay.
But let's talk for sure. But if others have ideas of things they want, please let me know via email so we get that included.
Yeah, I can tell you now that, what I'll be suggesting is that the state partners that I have that do prevention work, CDC, the Department of Education, Department of Corrections, that they be solicited, because like, if we talk about school-based, but I think that Commissioner Macon should actually make the call on, well, who's the one person that she feels is responsible for that in her shop, and they can say to the work group. So.
Thank you. All right, great. No other questions? I don't see any hands up on Zoom. I think we are set. We have a plan. Thank you. Thank you.
I'm back to writing my grant.
Oh, that is such, would you like us to keep you longer?
Part of me would like you to, the responsible part of me, but no.
You gotta do that grant work. There you go. Thank you very much. All right. Committee, I am gonna easily say, I'm gonna move governance to the top because governance has not met in the month since the last meeting. And we do have a meeting planned in 2 weeks. We will be discussing committees, we're discussing term limits, and discussing a bylaws change that Brendan had suggested, but we tabled it at the last meeting. And those are the items that will be before that meeting, but other than that, we have nothing to report, so.
Could you remind us of the date of that governance?
The 28th at 10 a.m.
Thank you.
28th at 10 a.m.
Yeah, on a Zoom, yep. Thank
Madam
you.
Chair, maybe now's not the right time and you can correct me. I came in a few minutes late, I apologize, and we breezed through this request we got from AFA. I haven't seen any written request. Did we get a written request? And is governance looking at that, or are we gonna have a chance to talk a little bit more about that?
So we just
I don't need to do it now, governance made me think of it.
Yeah, we just got a written request asking us to attend. So this meeting, there wasn't any request for money, we were just asked to just go and just sort of, the original request came to the AG's office. The AG's office asked that you include the chair of this council and Brendan into that meeting. So nothing is formal, it's just sort of an information gathering piece. So that's where we are at the moment, and that came Sunday. Some people don't know that's the day of rest. And go, yeah.
I think for the sheriff's benefit, I could say the following. I really picture this as a repeat of what the presentation was to the Health and Human Services Committee. The Attorney General leads and presents the overall landscape of the settlements. Brendan is there to assist. Pat then is going to present remotely, but she speaks for the council. I do not intend, I was invited, but don't intend to present or to be available for questions or alignment. They've asked for that. There's no, it's informational. There's no, but I do think it's really important that frankly, that we emphasize that that we are different than the state. There are people in that room that actually want to simply supplant, take the state resources that are now dedicated or intend to be dedicated and just eliminate those from some kind of measure because they think we're going to do it.
Yeah.
And I hope that the chair will push back very hard on that. The role of the state legislature, they have 6 members that were appointed around this table. That was their input. Now, they can ask for anything, of course, but they need to understand that they can ask. They do not have jurisdiction over these settlement funds. And I think it's so, they don't live with that every day like all we do. So I think we need, in appropriations, they're a little more familiar with us at the Health Committee. So that's my only request, is that the chair really, in a diplomatic way, let them know that we are not them, they are not us, and we have the 15 of us work to collectively determine our own priorities. And again, they can suggest, they can provide input, just like anyone else. But I think that really needs to be the theme of the afternoon, because people are trying to steal our money.
Yeah.
It's not our money, that we have the privilege of having custody of, to get it to the people who were most impacted by this epidemic. And so I think we have to deliver that message really forcefully. And I'm hoping I don't have to do it.
Yeah, it's one of those things, Brendan said it well. If we take our money and just supplement the work that the department's doing,
Get no gain.
there's no gain. And so we're trying to increase the system, increase access, increase prevention. But if they're expecting us to fund everything that they usually do, then we're at the status quo, and we all know the status quo isn't enough, it's not working. And so we just need to go there, present our message very strongly, saying, thank you very much for the invite. This is what we're doing, and this is where we're moving forward. But again, if we're just supplanting their funds, nothing changes. And we all know, everyone around this table knows we need to change, and we need to increase services. So that's what the meeting will be.
I'm really glad, thank you, Gordon, that makes me feel a lot better. That's my exact concern, and as a member of the council, you know, you certainly have my support to make sure that that message is clear.
It's clear, it needs to be crystal clear. Thank you very much.
Just for transparency purposes, they invited me as well. I plan on attending and hopefully not speaking as well.
No, let me be the
Well,
bad
if you
guy.
need somebody to be clear, just let me know.
And you can do it, that's why
And I do think they're mostly looking at the Recovery Council as a funding source, but also I do think we should anticipate questions about coordination.
Yeah.
And how they are going, the AFA is basically determine budgets or priorities, right? And they're determining priorities of the state and how things get funded. And they, besides just like, is this an available source? It's going to be, how does this work in concert with others? Just like we're struggling with the municipalities on the other end of the spectrum, right? So that is, I think, where the conversation will go.
Yeah, I think we're all on the same page, so I thank you for that.
And just for clarity's sake, it was a short turnaround between the request, which came on Sunday, and the scheduling of the meeting, which is on Monday, so.
And I'd come down, but I can't, I have a medical procedure, so I will do it via Zoom, but I'll be clear. I'll get the message there, so thank you. All right, if no other questions, we're gonna move on to finance. Ben?
Yes, I am the treasurer, but I missed the last finance committee meeting because I was talking to AFA, I think, actually, on DHHS budget items, but I know it's been requested that we just start off the meeting with current balances and then the inflows and outflows of funding, so we can start there, and I know Brendan has some updates around the current settlement dollars, so we can go to that next. But the current balance, the most current I have is as of January 31st, is $17,789,885.48. So basically $17.8 million. During January, we received revenues of $59,000, that is interest, and we had expenses of $24,000. The biggest piece of that was Dr. Johnson's contract. That was a one-time thing. So that is our current balance. I can give a quick readout of the last finance committee meeting, but does it make sense to talk about the current status of settlement dollars and the expected timeline? So I'll turn it over to Brendan.
And I'll be as brief or as thorough as you wish. Five new, I always call them new, 5 new opioid settlements with Walmart, Allergan, Teva, Walgreens, and CVS have now been entered by the court here in Maine. And so those settlement dollars will begin to flow. And the schedule looks like between tomorrow and July 15th, about $16.3 million will come into the recovery fund. I can break that down a little bit to the extent that's helpful. Tomorrow, the recovery fund will see just under $1.3 million come in. Sometime shortly after March 21st, an additional just under $9.7 million will come in. And then during the summer, sort of June through the middle of July, another roughly $5.3 million will come in. So again, $16.3 million will come in. That'll be what we know right now of 2024 payments between tomorrow and the middle of July.
Brendan.
And by the way, that's just the the way the money comes into Maine, it's like 100% of the money comes in. I've just described the 50% that goes through every council. The subdivisions will get a total of $9.6 million during that same time frame. The Attorney General will get a total of $6.8 million during that time frame.
So just to clarify, 16 million is what we are receiving to allocate.
Correct.
Got it.
For 24.
For 2024, right.
Thank you.
Is it possible to get a report, like a printout?
Yes.
Something?
Yes, this is on me, we're in the process, Haley's updated our spreadsheets that we post online, both of the estimated payments and the actual payments. And they just have to sort of finish internal review, which is on me. We always post the actual payments that come in and the date that they come in. And so every time, when payments are made on, tomorrow, when payments are made on the 21st, when payments are made in June and July, we'll update the actuals payment spreadsheet on those days.
Yeah, and I guess I was thinking about the projected fund, just to have an idea of what's coming and when it's coming.
Yep.
Question, I suspect I know the answer, but the 17.7 million, that's kind of old money.
So
the 17.7 million before the.
Oh, yes, the current balance.
16.3. I'm assuming that that's cash and that you haven't removed from that the 9 million that we committed in December, but we haven't.
That's correct.
That's correct.
It does not include anything that's been expended to date, like the few administrative expenses that we have. I'll get to the intent of your question in a second.
No, that's my question. I mean, I think of these things in big numbers that, in my head, what I'm thinking is that, well, we committed about 9 million. We have 34 million to now in the end of 2024 calendar year, let's say. So that gives us about roughly 25 million, of which you won't want to spend it all. But again, that's what we have to work on.
I am literally looking at a spreadsheet of the budget that we developed, and then I've racked up the funding of what we have committed. I'll use the word committed as opposed to expended. And then, but we will, I'll work on a more sophisticated spreadsheet that we can review, and we can circulate on a monthly basis. I give the top line numbers that the council made, but there would be more detail in the budget, because we decided as a council that the amount of cash that we have in our bank account is not what we want to spend every year, right? We established 15 million, 10 million ongoing, 5 million one time as a year one allotment as the budget for year one, and the same for budget year two. So we'll actually, and so we basically will have, after the $16 million deposit, we'll have close to that amount through this next calendar year, basically. We established a $30 million budget for the first 2 years. We'll have 27 million in a few months, and then that doesn't include the 25 receipts. It's a lot of numbers in years, sorry.
Got it.
Excuse me, Brenda, just quickly, will the spreadsheets be updated for the subdivisions too, that we'll have a chance to see eventually?
Well, our spreadsheet has everybody and breaks it down for the subdivision, so yes.
Thank you.
But also, just to pick up on, Sheriff Brackett, your question reminds me of another question you asked previously, which is, I just want to sort of characterize these payments a little bit more, in the sense that, just a reminder for everybody, the settlements are designed to sort of front load significant chunks of change. So this is what that looks like. And what we're seeing of that $16 million, a big chunk of that is Walmart, which is paying basically 2 chunks of money, and then it's done. It won't, it's only paying in this year, and it walks away, and other settlements will continue to pay over time. You'll see that dip, but that's just to remind you what the payment schedule kind of in general looks like. Also, the 2 payments that happen tomorrow are, so one of the original settlements is called the distributors settlement, that's 3 distributors. 2 of them have elected, as they have the right to do under the settlement, to prepay a particular year of their obligations. The 2 of them elected to prepay their year 7 obligation, which happens in 2027. So they're moving that payment from 2027 into this year, and that's coming in tomorrow. That means that in 2027, the 3 distributor payment will really be just 1 distributor paying. So that, and our spreadsheet will reflect that as well. So a little bit less in 27, a little bit more now. The money that comes in now is adjusted, in various ways to represent, inflation or the reverse of inflation.
And these distributors that have elected to pay more now are doing so to save money on the back end?
They get a discounted rate.
Well,
Or a dis,
I'm not gonna speculate about why they're doing it.
but that's what's happening?
What they're paying the amount of money that it would take to put in the bank now and to earn interest and equal the amount of money that they would owe in 2027.
Got it.
Does that answer the question?
Yes.
And that prepayment, we had elected, I believe, last month to just bank that and not even consider it until 2027.
Was that in this program?
I think it was in the finance committee. That we said what we'd do is so our original, how we spread it out, we wouldn't spend it, even though we received it in this year, we would add it to the spreadsheet the way it's supposed to be, as we voted on it.
Well, I think that's, I wasn't there for that conversation. I think that makes sense conceptually. I think what we should, the way that I would operationalize this is the budget that we approved is going to be a living document. The numbers are going to change. The amounts and timing of when we get the settlements are going to change. So we just keep that updated to make sure that the yearly budgets we establish still make sense with the flow of cash that we're receiving on a year-by-year basis, because it is already significantly different. We were supposed to receive 14 million in year 1, which was 2022, and 14 million in year 2, which was last year, and then 5 million this year. We're receiving, we have 17 million, like we just heard, and now we're receiving 16 million in 2024, when originally we were supposed to receive 5, we were receiving far less than we were supposed to last year. So it'll be a material change, but I think directionally it'll be similar numbers, but I think we'll just need to have some flexibility with the budgets that we outlined.
And just to clarify my comment to Miles, when this money comes in from these prepayments, it won't be quite the same for us to put it in the bank, and we won't get exactly the amount of money we would get in year 27 because we're applying, a certain interest rate that the state earns on those accounts, which is different from the sort of reverse interest rate that's applied in the settlements, which was negotiated and locked in stone.
So just a couple other, just a readout from the finance committee. I think we'll take a look at the application for funding when that's ready. From a financial perspective, we will, I think there was a request to determine the distribution of funding. I would like to talk more about that because I think I don't want to arbitrarily decide how much funding is going to which pillar. I think we should let our priorities and our decisions as a whole council sort of guide that process. Yeah. But we'll talk more about that during our next finance committee meeting. And then the third item that was discussed is exactly what Paul just brought up, which was make sure that we're not spending more quickly than we intended to because of the prepayment issue with the settlements.
Correct.
Any other questions about finance or finance committee agenda items?
Thank you very much. So we're going to turn it over to grants. Joe, are you there with us? Grants committee has been very, very busy.
Yes, we have. Can you all hear me?
Yes.
With my nose running. Sorry I couldn't be there in person, but I'm keeping my germs away from you all. So just to give a quick update, and then I'm going to pass it over to Gordon to help out. He's in the room and can offer some more information. But Mary sort of provide an overview of the sort of funding opportunities that are, or not opportunities, the secured funds that we've already appropriated, that contracts are being developed and her and Ella are working on those, as well as the grant application. At the last meeting, we spent a lot of time talking about the Recovery Center in Piscataquis County and had guests Barbara Skinner and Georgia Underwood there talking about their proposed idea. And Gordon will speak more about that and who they are and their organization, which I think he teed up at the last meeting, but very interesting group with ideas about their recovery center. We talked briefly about the detox center in the Androscoggin County, and the committee will pick that back up at the meeting next week and dive more into that work. And then Mary also mentioned the priorities, and her and Ella had sent out a document. So we're looking for council members' feedback around priorities that we can sort of build the plan. But I think we wanted to spend most of this section's conversation talking about the Recovery Center in Piscataquis County. So Gordon, I'm going to turn it over to you because you've had ongoing conversation with Barbara and Georgia.
Thank you, Bill. I would, and maybe Haley or Mary might have this, there was a motion that the grants committee made directed to the council, and I'd like to start the discussion with that motion being read or acknowledged.
And we also are going to discuss, after Gordon, we're going to discuss the application. We have a draft application here, Joe, that Mary's going to put up for people to see.
Perfect.
Because we want that. I have this goal that's out in April. I know it's ambitious.
It's perfect.
So I think Haley has the motion.
Yeah.
She's looking for it. Sorry, it's buried deep into my folders.
I should have given you advance notice and we have
I've got it. So
she's got it.
Great.
The grants committee voted to recommend to the full council that the council review the amount awarded to Piscataquis County to ensure they have the operating and staff funds to run the recovery center.
So, and I believe that motion was unanimous.
Yes. Yes. There were some people absent. Yeah.
So we had discussed that in each of the projects that we supported in December, that like for the most part, each of the organizations that we would end up contracting with would have a chance to come into the grants committee and say how they would do this. So the first group we had in was actually Alpha and Mayans, I recall. But at the last meeting, we had invited Barbara and Georgia, who are two of the board members of the it's a new nonprofit that does have their 501c3 status, and it's based in Piscataquis County. It's called the Recovery Wellness Initiative. And I thought, they presented a budget and a plan and a timeline. I had actually proposed 7 or 8 questions to them that they went through. We can share with you those questions. What services do you intend to provide? What's your timeline? How do you intend to reach out to the other communities? How do you deal with transportation in a county the size of Piscataquis, 17,000 people in a county that's really big? And we spent almost an hour with them, as I recall. And several people on the grants committee were concerned that they didn't have enough money in the budget for staffing. And because they're each working part-time, and so, without going into more detail than you really need to know, I think, we asked them to go back and submit a different budget that provided at least one more full-time person to be kind of the on-site manager, so that it could be open more hours, and there is such a person available and wants to do it and is already leading a support group of 10 to 15 individuals in recovery in Piscataquis County. That, to me, is going to make this effort successful, because you get not only all of the work that's been done with the cafe community, so to speak, but you also get this amazing young man from Guilford who's already in a church about 2 miles away from this property, already has 2 meetings a week, and is also attends meetings at the barn. So, so they did come back with a couple different budgets, one of which I met with them on yesterday that I'm comfortable with recommending. And that's the budget that you picked up on the way in today and that I have in front of me. And again, most of the increase from $350,000, which we voted in December, most of the increase is in the line for maintenance and volunteer coordinator, 40 hours a week, $24 an hour, some fringe benefits and things. And that picks up over the 2-year period about $100,000. So the total, so understand that this wasn't their request. We, members of the grants committee, said, we want to give you the best chance to be successful. And we really think that you need more staff. And Courtney was very strong voice on that, having worked for a while, been involved with at least one recovery center, and feeling very strongly that you need, volunteers are really incredibly important, but you need staffing. So I met with them yesterday over Zoom, went back through this budget, and what you have in front of you for the 2 years is $501,088. They have a purchase sale agreement that's contingent upon getting funding, but they've been able to negotiate a purchase price for the property of $145,000. It was listed for $195,000. Now, part of the reduction was not buying the parking lot across the street. If I was doing this transaction personally, I would have bought a park. But again, you know, it was not, there's only so much I think that we want to do here. We have been way more involved in this singular project than we will ever be involved with Recovery Center again. Partly it's timing, that we don't have other centers we're working on because of the state scoring those 22 applications. And partly because, again, it's a very important part of the state to us, very rural, don't have a recovery center, don't have recovery residents, not much there, and lots of people needing help. So I'm prepared, I don't want to make the motion now, but I'm prepared to, and Brendan can help us here. I don't know that I need to amend the motion that I made in December, but I'm prepared to recommend that we proceed with developing contract with the wellness, with the Recovery Wellness Initiative in the amount of this new budget, because they've done this budget at our request. And this will, I think, give them the best shot at it for 2 years. I wish we could, and maybe we do, I have read the 60-page inspection report. I've read the purchase and sale agreement. I've gone to the property, but not visited inside of it. I have met with the board. I have met with the staff 3 times. I've interviewed the prospective staff people. Again, we have been really done a lot of due diligence here on this one, and for the reasons that I've discussed. And I feel very comfortable with it. I wish we could show you the slide, maybe we can, of the church property itself. It's actually quite a nice property, finished basement, so we can do support group meetings in the basement, a nice stained glass window for the big room, that'd be a community room. They will remove the pews and have a big central meeting. They want to get in there before July. The purchase sale agreement, again, they'd like to close quickly, and I've said, you know, this could be the first check that has to come out of our account. And so, you know, it's gonna take some time to develop the contract. So again, I said, you know, I tried to be realistic as to what the time frame might be, but again, all my motion would be is to authorize our staff to develop a contract, offer a contract for this amount of money, and then we'll do the heavy lifting on the terms of the contract. It does involve the purchase of a building. I suggested, and as you know, that we've done this, the state has done contracts before that included the purchase of a building. Milestone would be an example. So this is not unheard of. Nonetheless, most of our recovery centers did not include the purchase of a building. Some of them are leased, but again, this is different. This property was available. The members of this council were the ones that 2 meetings ago looked at me and said, well, can't we just, no, we want to do, we heard that testimony. This is the group we want to support. This is the property we want them to buy. And so we're prepared to do that, to authorize that today. I'm happy to answer any questions. I had suggested that I don't think we've not shared with you the 60-page home inspection. I think it was formerly a Catholic church. It's been in the ownership of Dr. Stafford since 2017. I'm not a real estate person. So there were 2 real estate brokers involved in this transaction, and the building's pretty good shape. Pretty good shape there's things that need to be done. They're gonna have to have an electrician look at a couple things, but when you read through the whole report, it's not a mess. It's actually quite a beautiful building, and I'm gonna recommend that we get this done. And happy to answer any questions that you might have.
I was just gonna second the motion.
Well, then I'll make the motion. I will move. Well, let me ask a question first, and then would it be more appropriate to amend my previous motion, just make a new motion?
I have that Courtney made the original motion.
Oh, yeah, that's true, because she added, she added.
Because she was at 100,000 more, yeah.
You're absolutely right.
Is the issue at hand the fact that we approved 350 and now we need to increase it to 500?
500, 501.
$501.
Yes, that's the entire purpose. And also, I think, to authorize us to move ahead with the contract. And again, it will be maybe our first contract, so I'm presuming I'm hoping that our contracts, honestly, once complete, could be approved by the executive committee. I don't see every single line of every contract coming before all 15 of us. We know way more about this, all of this thing. And so anyway, but probably a new motion then by me.
Yes, I recommend a new motion for the amount that the committee decides is the right amount. I've heard $501.88. Unless others think it should be a different amount, whatever. I guess that's the point of the motion.
Right,
you make the motion and then others can object.
And that's for 2 years.
2 years. Do you think, Brendan, that that the motion should include authorizing our staff to draft and negotiate a contract with them effectuating this transaction?
So your motion would be that we approve 501.
I would like to ask a question before I make the motion.
Yeah, just good.
Just because we'll sign up on about 1,800 contracts a year. So we have a budget that's very specific in front of us. They are purchasing a building and renovating the building. There will be cost overruns and other places where they don't spend. Are we authorizing them to spend $501,000 in 88 over 2 years? Or do they need to come back to the council if they exceed $500 for food in year 1? Or they,
I would hope they wouldn't have to.
I'm just making sure
come
because.
back. And again, I think it's up to the staff and negotiation in terms of how, we're not gonna send them a check for $501,000. We're going to, I would guess the initial check would cover the purchase price and the closing costs.
That was my next question. Do they need all of the $145,000 at closing? I presume they probably do.
Yes.
Yeah.
And then some, there's some closing costs there. But then we would, you know, again, this is our first contract maybe, you know, we would probably make it quarterly. I mean, that to me is part of the negotiation with them, that we'll draft a contract and we'll share it with them and then go back and forth on what their needs are. I mean, we've all expressed an interest that we don't want to have them do the work and then invoice us for it. We want to give them the money up front. They're a small nonprofit organization. And we realize the risks inherent in all of this. If they end up with a building and like one thing I'd like to put in the contract, for instance, is like, and I think it's part of Maine nonprofit law, that if they go belly up and they're held, and that's this property, they should have to keep that in the hands of a nonprofit organization to serve a mission that's as close to our mission as possible. You know, we have to, you know, that's a lawyer's job. We got, how many lawyers out there? Just two?
Too many, no.
Two and an 8. And, that's a so.
I'll take anything.
I think, again, you hope for the best, but you need to take these contingencies into account. And we don't want property to come back into the ownership of the Maine County now.
Yeah, and I mean, just, sorry.
No, go ahead.
I was just gonna, I mean, I think anyone who's worked with DHHS or the state, we have pretty specific requirements, and they exist for a reason, because if you don't approve things on a line item budget, then I'm not saying this by any means would happen, but then you come in and you're like, actually, I spent $20,000 on food, not $500, and now I cannot actually, I do think there needs to be some sort of control in the contract of like, this is the budget we approve, and we're comfortable with 20% plus or minus in each of them, and if it's not, then they have to come back, because and then we have to decide on the distribution of the funding as well, but like, you know, if when something, with construction, something is going to come back and it's gonna be, the renovation costs are gonna be twice as high as what they might suggest, and then they're eating into their staffing costs in year 2, and it gets off kilter from what the original plan was, so I think there needs to be some sort of control in place for the approved budget that's ending in an 8, which is very specific.
You know, I absolutely agree, and I think it's a very important contract because, you know, we may be supporting additional recovery centers in the future, and we're gonna look to this contract probably. And I think, again, some of that needs to be negotiated with them. What I'd like to accomplish today is simply to authorize the approval of a contract to be drafted in this amount, and then those, how much they can vary each category, absolutely, those things will have to be worked out in the back and forth before they sign a contract, and we have to be respectful of Brendan's time. I mean, I think, because they're gonna wanna know when can we close. I mean, I think we need to talk to Mark, and how long is it gonna take to run it? I mean, it's gonna take a couple months.
I wanted to speak a little bit to what Ben, and maybe ask a couple of questions about the topics Ben was talking about, but I also saw that Bruce has his hand up.
I'll be super quick. My concern is getting them the money for the closing costs, and then they're gonna wanna hit the ground running. And what kind of step can we build into that initial piece? Some funding, certainly so that the staff can just get in there and start doing the work that they wanna do.
To talk a little bit about kind of this contract, I mean, we've been doing some work, which is Ella and Mary and others have been gathering documents for me to use as foundational documents as I start. What I'm starting with for transparency is existing contracts that the state has with recovery centers. I've also got a copy of the 2023 RFP for the next round of funding for the recovery centers. So I'll be looking to those contracts and those RFPs for the sort of language about what this group is expecting the Piscataquis folks to do. To the extent this group intends to deviate from those existing state contracts, one way it will deviate is, here, go buy a building. But basically I'm starting with the state's kind of existing template of here's what recovery centers do and what we're gonna fund them to do. My expectation had been that I would send drafts of the contract to the finance committee for its review, and have the process work that way. An issue I've been thinking about is sort of what the two of you were talking about, which is how the money flows. I've heard from the council that it wants the money to go up front. Does that mean 100% on day one? The way, as I understand it, DHHS does things as an invoicing process. I'm still learning about it, so you can talk about it, in more detail than I can, but, I think I've heard that this group doesn't want things to be invoiced out after the fact. They want the money to go up front. So I've been, sort of thinking through different ways that could happen. You could do 100% up front, you could do year one up front, year two up front. But, the issues about controls are things that I've been, worried about. The scenario that Ben's talked about where there's an they've run over their budget, in that scenario, they'd have to come back to us for an additional grant if we're providing the money up front.
In residential contracts that the residential programs have, you have a monthly payment. You're paid a regular monthly payment. And then quarterly, you submit a budget. And I think recovery centers may even have the same thing. They receive a monthly payment, they send a quarterly report. You have to show if you have a variance in any of the budget versus actual are there, and you can see it. So you can control it from that piece. Again, that's how I know that the residential programs used to, but I've been retired for 5 years. And I know that recovery centers were the same way. They receive a monthly payment, then quarterly they submit budget versus actual. And then it allocates a way that, again, it'll pop up if you're a certain percentage. I won't say it in a LePage error, if you had to pay if you didn't spend it all, you had to send it back quarterly. I don't know if you have to do that anymore, but that's a way to control that. So you're not giving out $500,000 to a small agency, you're giving them monthly payments, which again, they can meet their payroll with, they can meet the expenses with. Again, you're gonna have to give them some money up front because they need.
We'll certainly give them the money for the purchase of the building.
For the building, yeah.
But how else is the rest of it supposed to work?
I don't disagree with anything that you just said. There is a big difference between ongoing contracts, which is generally what DHHS and the state funds, although I actually shouldn't say that. Most of what DHHS funds are ongoing contracts. We're funding the services provided from a recovery center. This is different, and we've increasingly, because of inflation, I think, and sort of our conversation before, we have been funding one-time contracts to help costs to fund startup of facilities, basically, SUD treatment facilities specifically. Those look and feel pretty differently, and we can discuss, we've been doing thirds, we can do 50% upfront and 50% after they meet a certain milestone. But I think that the difference between is like a funding to establish the facility in the first place, and then the year two contract will look very different, I think, than the year one. And what you described with invoicing is accurate. the state technically reimburses providers for costs already incurred.
So if I can, for the sake of time, because I really want time to look through this application. So can we, is it possible that we can vote on a motion that includes the increase in what we're gonna do, and that we leave it to the finance committee to work with Brendan to work out the contract with them?
Yes.
I'm happy to include that in the motion. I'm going to move that we authorize staff to develop a contract with the Recovery Wellness Initiative to develop, operate a recovery community center in Scottsbluff County, specifically in the town of Sangerville, Maine, and that the grant contract be in the amount of over 2 years of $501,088, consistent with the budget that was submitted to us most recently by this nonprofit organization.
Second.
It's been moved and seconded. Further discussion?
I just want to point out.
John and then Ben.
No, it's okay, but go ahead.
Most of the costs in year 2 are going to be ongoing costs. I realize we're just funding year 1 and year 2, but we will need to have future discussions about how ongoing costs for staffing for this facility is covered.
Yeah. Correct.
And I just have a question about what you mean with consistent with the budget.
Well,
Because I'm a little concerned. I'm glad that we're gonna have a chance to talk about it at the finance committee about how that's all gonna play out, but
well, I didn't feel like I should just throw out the $501,088 without referencing where's that number come from.
They've submitted a budget.
Submitted draft budget that we can then, in terms of how much can they vary the budget, that will be worked out by the finance committee in the contract. And I think, by the way, that, remember, these organizations have the ability to raise some money too. I mean, I have a recovery center in Fort Kent, they raised we haven't given them a dime, they're doing a fantastic job, they raised $28,000 on their own. So it's not a given that if they need more funds over the next 2 years than we've committed, that they come running back to us. That were they to call me, I can give them a number of places to go first, because we're gonna have a lot of demands for this money. The state's not gonna be able to support all recovery centers that, want support, need support. So, no, I think this is the most we can do for them, and it gives them a great shot at success over 2 years. And they will do some private fundraising and grant writing as well. So I think I finished my budget and my speech.
Does that answer your question, John?
well, sort of. I think we can talk about it at the finance committee, we'll have a chance to work
Yeah,
out.
and when you see what the state does and how they work it, it's accountability.
My only concern is that, and I'll just leave it with this, right? So I realize there needs to be checks and balances, I support that. But it's not a state contract. It needs to be, and we don't want to overcomplicate it. You know what I mean? And we're going down a road here where we're gonna enter into a level of trust, so this, you know what I mean? So I just want to I hope we're able to keep that in mind, you know what I mean? And, under the understanding that we're under no obligation if they come back.
Correct.
Right?
Correct. Anybody can come back and ask. Liz? All right, well, there's been a motion made and seconded. If there's no further questions or discussion, then I call a roll, please.
Liz Blackwood?
Yes.
Todd Brackett?
Yes.
Lydia Krause?
Yes.
Joe Everett?
Yes.
Fitzgerald?
Yes.
Courtney Garriott? She's not here. Pat Kimball?
Yes.
Ben Mann?
Yes.
Bruce Nodden?
Yes.
Miles Alette?
Yes.
Eric Small?
Yes.
Gordon Smith?
Yes.
Kia Thacker, also not here. Chastity Tool?
Yes.
And Paul Bitzel.
Yes.
Motion carries. Thank you all for your patience. And Joe, I'm going to, for the sake of time, let Mary take over at this point and share with everybody, because I really want everyone to see this draft of the application that Mary and Ella have put together. And I also want to respect that you get out of here on time. So I'm going to turn it over, if that's okay with Joe, over to Mary and let Mary move forward with the application.
Okay. Haley, do you mind if we?
I never got anything from you with that. Or it's not in the March. Oh,
No,
no, I got the second one.
No, it's just in the email.
Yeah.
Yeah.
Second email.
So as Pat mentioned, with the hope of getting this grant application out by April, I recognize that there's this council meeting, we have 2 grant program committee meetings, and 1 finance meeting. So the hope is to vote on a final draft of a grant application to be marketed and publicized after April 11th. There are a couple questions. I guess the way I want to frame this is, I don't know what the council's comfortable having the grant and programs committee decide versus what the whole council would like to deliberate on. What I did is we pulled together a grant application as an initial draft to just help guide the discussion a little bit and ground it so that we have something to work forward from. There are a couple of things that I feel are top priority to discuss and are bigger picture than some of the granular details which the grant and programs committee can work through. So here's an overview of this draft. It starts out with really just an overview of what the application is, as is standard. And we're still working through some of these, but the language is more or less, again, drafted as you see it here. We don't need to go through every piece of it, obviously, but I do want to start with an overview of eligibility for the grant, because I think that will segue really nicely into the priority discussion and then how we want to budget and allocate funds for the grant specifically. So if Haley, you're able to go, it is the 3rd bullet or 3rd topic. Yeah. Okay. So I guess and I don't know if Joe wants to sort of lead this part of it, but here's where I think is important to start, of which organizations, are eligible for this grant application, and also what sort of programs and activities, which is related, but can also be a little bit separate. What I've gathered from the council so far is that this application would be open to all organizations, nonprofits, for-profits. If that's different, please let me know. And that organizations need to be based in Maine and serve people in Maine to be eligible for our grant application. Otherwise, I haven't picked up on too much direction.
Do you want questions as we go or at the end?
I'm fine with as we go. I'll take that.
Based in Maine, is that like incorporated in Maine, or just do they operate a facility in Maine? It's not really for you, it's just for the council entirely. I don't know, because that will come up.
Mm-hmm.
So for instance, okay, so let's use an example. So I'm an out-of-state company. I'm not based in Maine, but I want to bring a program to Maine. Does that make me eligible or not eligible?
It looks here like you have to have a physical presence in Maine at the time of the application.
Okay.
And this wording can be changed. Again, I just wanted to give us a place to go from, so please feel free to tell me to strike out anything that you don't like.
What does a physical presence mean? Like a PO box?
For PO box.
We should look more clear.
Because if you think about some online treatment programs, MOUD programs, that don't have, they have physicians in Maine, they don't have a brick and mortar place in Maine, and they serve Maine. I guess I would say, if you serve Maine people, that is a physical presence. If you currently serve Maine people.
Liz?
So I have two things. One, I think if we open up the door to like anyone in the country to apply, that I hear you on like that it would be great if somebody serves somebody in Maine and is out, and it's something we don't have in Maine. I think if we open the door, it's like bonanza town, so I would prefer we have something like you are incorporated and based in Maine, or some language that makes it really clear that you're a Maine organization. That would be my preference. And I also am just curious about people's thoughts about for-profit and funding for-profit organizations. And if there will be if we will have different things in our contracts about for-profits, because they operate under operate under profit. And I don't know if we're in the business of and maybe we are, so
We are, because almost all your MAT programs are for-profit.
Are for-profit, okay. I was thinking they were under healthcare organizations that aren't necessarily for their own.
And in terms of like sustainability for like detoxes and some of these places, for-profit, I think, we want to build infrastructure and sustainability with some of these, like we're saying with MAT programs or detoxes or certain, and these places will be taking or should be taking, and I guess that'll be Maine Care beds, not just, cash beds or, in those terms, I guess. Sorry. That's my thought.
Gordon?
When we get down to the nitty-gritty, we can, you could give extra points for being a nonprofit. In my experience, just to give a simple example that you're familiar with, I've not really found much difference between the for-profits and the nonprofits. For instance, even in our catalyst and capital things, we just Milestone, we've got a big investment in, they're about to open, it's been nonprofit. Pine Tree Recovery, owned by a for-profit organization out of Maine. So I don't think we should distinguish them. I don't think eligibility should matter, but you could give some extra credit. I also don't think that it should have to be a corporation. I don't know why we would make individuals who might be doing business on their own without having formed a corporation. We're going to have all kinds of opportunities. Some of them could be small, could be a mini grant for $5,000. So I don't think we should limit our applications to corporations. I think individuals. And I don't have a strong feeling. I wouldn't. I hear what you're saying about some connection to Maine, but I think the physical presence at the time of application is way too stifling. Partly for the point that Dr. Vincent brings up, that we're trying to do mobile telehealth, we're trying to get care to people. Do I really care if that care is delivered in Portsmouth, New Hampshire to my patients in Maine? No, I don't.
Yeah, I was gonna say something similar about, I agree that there ought to be a physical impact in Maine, you know what I mean, but physically be in Maine. And I also wonder, maybe I'm overthinking it, but until we get caught up with the epidemic across the board, right, and we have a long ways to go.
Yeah.
I know folks in Lincoln County who have needed some funding assistance to go to detox or treatment out of state. I'm not saying that we necessarily fund that, but I'm not saying that we should necessarily prohibit it if it has a direct impact on a Maine resident or a physical impact here in Maine.
So if I'm hearing people right, at this point, we're looking at eligibility, that your eligibility at this point is serve the people of Maine. I do have some concern, like Liz, about opening this can, but let's see how it goes first. But is that what I'm hearing from people?
That's impossible, like, we're just gonna trust people that they're gonna do that?
I just
don't
think
know.
where there's
Again-
money, where there is money, there's always somebody to look to
Oh, yeah.
gain the system. And so I want people who are legit and who have good ideas to get this money. I'm also very aware, as somebody who receives a lot of requests for not legit stuff, that I want to make sure that whether it's, we can weed them out in the contracting or in the scoring, like there's other ways we can weed it out.
Correct.
But we just need to build it in though, all the way through, that what we end up funding is super legit, and we have some like.
Oh, yeah.
Because I know, but it's easy to have people who are gonna, this problem that is huge brings out everyone and their mother to make money off of. We've
Sure.
seen it for years, just like how we got into this mess in the first place, which is pharmaceutical companies taking advantage. So I'm just mindful that we need to make sure we're building that in.
So let's leave that sort of generic where it is, and then look further down this application to ensure that those kinds of pieces are there. Because I'm very concerned that we have to have some sort of, when we score these or when we grant them, that these individuals or companies, whatever they are legitimately going to do what they say, and there's some accountability there. Bruce?
One of the best ways, at least that we found, and certainly when we were tiny and we were just a volunteer organization, we solicited fiscal sponsors. And so there are nonprofits that you can speak to, and certainly if they're willing to go to bat for you, if it's a good enough idea. I just had somebody approach me yesterday. You know, we're not, nonprofits aren't just gonna jump on just anything. And I think it's one of those ways that you can do that. You can talk to other nonprofits and they can be a fiscal sponsor. And usually the goal is that that organization will become their own 501c3 at some point. But that's kind of a gatekeeper way to do things.
And we did talk about, Mary and I talked about when we were doing the application, one of the things is that it's one thing in reviewing the applications, but once we finally say, these are the ones we're funding, then we probably need to do a deeper dive. We're not gonna do a deeper dive into every application we get, but when we narrow it down saying, these are who we're funding, we may at that point wanna say, let's do a deeper dive and make sure that who we chose has some, has credibility to move that forward. So, all right, so.
I don't wanna, well, I'm going to, but I don't really wanna ask existential questions, but is this application the main or possibly the only way? It's clearly not gonna be the only way that we're going to push out funding, because we've already allocated 9 million, but once this is up, is this basically the main way that we're pushing out funding through this council, or are we gonna put $1 million behind it a year, which is a fraction of what the earlier budgets are?
So that is a larger conversation, I think. So the application is meant at this point to be, and we can make it differently, can be somewhat open-ended. And when Mary talks about the council has to determine priorities. So at some point in time, we have to have the conversation that maybe says, we're gonna spend $1 million here. Again, you'll see it in the application where it talks about scoring, and if you're applying for something that's in our priority list. But we also talked, and again, this is a larger conversation with the council, does the council want to set aside every year funds for projects that they, an innovation fund, that we see something that says, oh, this is perfect, this fits and aligns with the mission of the council, we're gonna fund that. We don't wanna, but again, that's a larger conversation for the whole council to have, as to how we distribute. But this application really was our first attempt at pushing the grant process through. Does that make sense, Ben?
Yeah, I struggle with it a little bit because I'm just used to like categories. We put in place a category, we want recovery centers, and then our eligibility criteria is specific to that category of you need to have prior experience actually delivering services in a recovery center, as opposed to this covers everything. And therefore, we can't, there's gonna be licensing, I don't wanna like, I'm really not trying to blow up the process, I just wanna try to determine the scope of what we are here, because I mean, even, like, clinical stuff is easy to come up with an example, like transportation, we wanna make sure someone is insured to drive other people around, right? And like, so, there has to be like a second tier after this application to determine eligibility that won't be published in this, but, so it's gonna be a lengthy process, I think, because we just have like an open application for very high level eligibility requirements.
So one of the parts of this conversation is it doesn't have to be open-ended. This one can be adapted to be specific, if this council wants to be more specific. And again, once we look at, you've all been asked to look at the grid and to look at look at our priorities that we discovered through data search, through public hearing, through our own work. So that's part of working with this. This is a base that we just left open-ended, but can very well say the council is putting this application out for recovery centers, or this application is for, because of, we're spending $2 million on recovery homes, and we can do that. And this is just sort of the draft sort of base. And again, I've seen the whole thing, so you all haven't. So I have a different look at it.
We spent 15 minutes on the first two lines.
I know.
You can hold questions till Mary has done her presentation.
Yeah.
Thank you. I also want to mention, I think this conversation that we're having is one of the most important questions from my perspective, because if this is going to be an application, let's say, that's capped at $50,000, that changes how I approach the rest of the drafting process. Or if it will be as open-ended as it currently is drafted to be, then again, that informs further discussions down the line, as Ben's also saying. We need to incorporate second, third, probably, tier eligibility, outreach, all of that. It impacts the scoring. So I mean, I'm open if the council feels it's important now to have a discussion around the targeted audience, really, of this grant application. I can also go through the rest of what I have, and then we can come back.
I just want to piggyback on what Ben said. I mean, this has been a concern of mine personally, is that we're not narrowing our focuses, and why, we're trying to figure out what all our priorities are around the table. And then once we figure out what those priorities are, then within those priorities and the pillars that we've already, identified, then this stuff works. If this is just a broad, open process, then we're gonna be spending, I think, Liz, that was one of your concerns was, we're just throwing it out to the world. How are we gonna sift through this stuff and actually, when folks look at what we've done, say, well, you didn't even really consider my application, and I had all of these criteria in my application, and you just, because you had so many on the surface, you said, oh, well, that one's out. I mean, we have to be pretty focused, and especially with the amount of money that we actually have to allocate.
See, this becomes like a perception is reality kind of thing, right? Because my recollection from, I'm blurred, right? I have too many meetings, so finance, grants, I'm not sure. We talked about this a little bit, right? Because I was concerned about it being too complicated for somebody who needs $5,000 for transportation costs. You know what I mean? Or just a really small, so, but I kind of came away with the idea that whether it was a dollar amount or whatever, that some of these applications would be very specific, targeted towards whatever, and then others would be maybe, for a lesser amount, would be less complicated, with the criteria you gotta meet, I'm rambling, but you know what I mean?
Yeah, and I totally agree with that, is that, I really think in order for us to be, flexible and nimble and all of the things, we need to be able to do both things, right? It's not mutually exclusive, what I said. I think it, you know, we can walk and chew gum at the same time. We can do this stuff, yeah. And $5,000 to some organizations is everything, like, it's a lot, you know?
But with that being said, a $5,000 contract is like much simpler, and you can oversee that in a simpler way. So it's like we need different, I appreciate like like having getting us on board with answering some of these big questions that we have to answer. And I think I'm definitely in the camp of like, if we choose our priorities, then we can make an application that's based on that priority and the pillar that then addresses the needs that we've identified. Because, I was talking to somebody at MEHAP, and they were and I just think using some nonprofits or some philanthropy as examples, like they have some small ones where they put out small grants that anyone can apply to for certain things. Their larger grants are almost always very targeted, very, more targeted, so you don't get a bazillion. It'll be we don't have a grievance process here, like, when somebody comes forward and says, like, how come you didn't choose me? What's the grievance? Like, I think that's all stuff we should be thinking is gonna happen for us. And so therefore, like, the more specific we are, the harder it is for somebody to have, for those sort of, if we do it and then we get like 1,000 grievances, we're comparing oranges to apples to peaches.
I just need to sort of just say something. So the reason this process went was because the majority of the people wanted a simple application opened to everyone. And so this was developed because of that. So I hear what you're saying, but now you're taking it, and I totally agree with most of it. I have a list of all the things, I've shared it with Mary, it's a list of things I think need to be done. But this was what y'all asked for.
I didn't ask for it,
Okay,
nor did we.
so I can tell you that it was discussing grants committee, that you wanted a very simple application that went out to all. So that's what this is. The other piece is you have a priority list, you have one, and then we asked Mary to go out and take that priority list, our priority list, the priority list from the public hearing, the priority list from the data search. She put it in a spreadsheet and she sent it all to you to ask you to put in order your priorities so we could go back, re-look at it, and redevelop our priority list. So those priorities are in the process of being out, and I think she's still missing some members from sending it. So if you need her to send it back to you, she can do that. So I just wanted to bring you to that space, that the priorities is, the priority list is being looked at, and you will have it. Again, she's still gathering members what they want. So that will be available for everybody to look at. And we certainly can put this application on hold until those priorities are discussed and set. That it's your committee, so you can determine to do that. And Ella has her hand up, and then, hi Ella.
Yeah, hi. I think that maybe this looks a little bit more general than what Mary and I had envisioned when we were going through the process of putting this together and actually writing it. Because based on Programs and Grants Committee discussions, there was sort of the understanding that, as Pat just said, that we would break this down into the 4 different pillars and then have very specific priorities within those 4 different pillars that could go into this application, either in the form of 4 different applications that pertain to each pillar with the specific priorities broken down in them, or with this one more accessible application that's a little bit more of a distilled version of one general application where applicants could check off priorities. And I think Mary and I were sort of envisioning determining what the priorities are based on the spreadsheet that Pat was just talking about, and then the research that Dr. Johnson has done for us already, and really working through those to make the priorities as specific as possible, and then figure out sort of like a vetting process for those priorities. I think maybe the simplest way to do this in a way that like targets both the concern that this is going to be too broad, but also the concern that, you know, we want this to be accessible and we want this to be an equitable application so that anybody can apply. Because I know that that was another concern, would maybe to be an application where the priorities are super specific, and then you all decide caps at the funding that we want to put out for this first round. And then you can have applicants request the amount of funding that they need, and we build in like the budget and why the method for evaluating all of that throughout this application. But I also do think that like that's something to keep in mind is that this can definitely change going forward in terms of round 3 funding and so forth. But for the purpose of getting this round 2 funding out, I think this has made the most sense in terms of developing this application so far. But yeah, I don't know if that cleared anything up at all or if anybody has any other questions. But I just wanted to clarify that we were writing this with the idea that the priorities would be very specific, and something that we need to focus on is the vetting process, because we don't want to get all these applications where half of them we can't even evaluate.
Can we
Thank
see
you, Ellen.
the rest of the?
Yeah, let's go to the end, that's the.
And then we can talk about where we go.
Yeah.
Joe's gonna say.
Oh, who's gonna stand up?
Joe.
So it's, hi, so just to sort of reinforce what Pat said, at the last program grants committee, people said they would not vote for any funding without an application. So I think that, you know, I think Liz, to your point, that there, if we did mimic sort of a foundation, there is maybe an open process, but then there is sort of like more, you know, there are grant proposals or grant ideas that could come as a result of our work. But I think people are really looking for this application to move forward. So I just wanted to reinforce that from the committee, Pat.
Thanks, Joe.
I want to move on and see everything, and it's exciting to react to something. I think a pretty main point of clarification that we're going to need to make is sort of supply and demand here. Like when we put out RFP, like DHHS, I'll just use myself as an example. We fund supply. We provide providers to deliver services. What I heard Gordon say is maybe we want to open this up to individuals, like we heard somebody going door to door to give out naloxone, who's not incorporated, you know, during the public hearing. We might want to do an application that has small dollar amount to do that. That it should be small dollar amounts, I think, and they wouldn't be incorporated as a 501c3, for example. But then I also heard Sheriff Brackett say we might want to fund people who are on like not the supply, like that actually need funding to go to seek services, but that's the other side of the equation, right? Like that's very different from, and I think just who is eligible to apply is a major threshold question that we're gonna need to determine, because those are like 3 main distinct populations in my head. I may have done a bad job.
They are just, it's very different funding, yeah.
And a different application process.
Yeah.
Okay, next page,
Okay.
please. Next page, please. All right, so this feels like an important page, and that what we're all getting at is, you know, the nuts and bolts of the application discussion here around. So if we do take this application and we have identified strategies that will be prioritized in the scoring process, again, that was what this application was sort of built around, as we've been talking about. That said, seems like we're open to like really honing in on what the priority is and then creating separate applications from there, which is great. And if that's the case, that'll change, again, the scoring process that I'm looking at, and also potentially the application questions. So I just wanted to highlight this as potential wording for, again, a generic application. This could be a small like a small funding award application where we say, here, pick your pillar, tell us which program and activity, this as listed under the MOU, your organization supports, and then tell us a little bit about yourself.
Ella, is your hand still up? Or
I just raised it again, just really quickly. I just wanted to clarify one more thing. Is that, you could all get really specific with the priorities, but this could also stay very flexible in the fact that it's priorities, not requirements, and you all get to determine who gets what. So I think that the priorities being super specific will be helpful, but it doesn't necessarily block out anyone else, just to clarify.
Yeah, you can do things like the United Way in my area has 3 bold goals: basic needs, substance use disorder, and child development. And you have to apply for one of those 3 areas. And then again, it's in the scoring. So thank you, Ella, for that clarification. You want to move?
Yeah, let's keep going. Please. Keep going. Okay. So this is getting into the questions that I was considering for the grant application. Again, just to start the discussion. Organization information, this seemed pretty straightforward and standard to me. If there's anything specific, again, as priorities change and as we decide on what those are, this will be adapted as needed. That's sort of a place for us to start. And then one more page, please. The funding request section of it would, again, under this current format, ask applicants to select which pillar they're applying for funding under, and then also, as part of the detailed project description, describing which activities, programs, strategies their organization supports, as listed in the MOU. So that would be a big part of this grant application, which was pretty consistent across states so far, of having the MOU really ground for applicants what was eligible for funding and what wasn't. Again, beyond the exact recipient, but the programs that could be funded for this. So this would, a little bit what that could look like for the proposed timeframe. I don't believe we've decided on this yet. I think the suggestion, what I've been hearing, is a one-time, one-year funding, especially as we think about future funding awards, future councils, all of that. But if that changes, I mean, we can also make it up to the applicant whatever the council wants to do. And maybe that's a finance committee discussion. But again, to me, that feels like a big picture question that maybe we have to wait for the priorities to decide.
Can I ask a question about that? Because I think as somebody, I'm sure many of us in this room have been recipients of grants, and one-year grants are really tough. Just because if you're hiring somebody, they're really tough. I don't need to tell you all the reasons they're tough. I guess I'm wondering, is this something that we have to do because we don't want to hold somebody, a future council, to continue to pay, or is there ways with the finance committee that we can address if we're taking all the money out of this year, but we give it over time so that people have more years to complete the work, so that it's adjusted in a way where we're paying for it now out of the funds we had allocated for this year, but we give people more time.
I as an executive director of a nonprofit for years, one-year grants impossible. They're really hard.
Totally.
If it would be up to me, it would be at least a 2 or 3 year. And if we enter into a contract with someone, I'm assuming that whichever council sit here has to abide by the contract, and I'm just assuming in good faith. And again, we can look at that, but for me, I convinced, my big thing was my local United Way now does 3-year grants.
Yeah.
And it's just so for 3 years, you, as a nonprofit, and these grants are no more than 50,000. But at least you could depend on, I got 3 years to do the 50. So I think it's one of those things we can look at in time. So why don't you quickly go through this, and then I'm going to make a suggestion.
Okay. We can go to the next slide, please, with just an overview of questions that were categorized into pillars similarly. I don't think we need all of these, but tried to cover our bases with questions that could be asked. The next slide was documentation we would ask for. Again, this would depend on which sort of applications that we're requesting, but in general, supporting documentation we would need. We would put out a budget template. The next page, if you want to click there, is the start of one. Next page. And I just started thinking through what these could be, but keeping it very simple, as has been discussed by, I believe, the full council and definitely the committee. Again, a place for us to start and add on to as we feel is necessary, and then that was it.
So this is what I think I'm hearing from everybody, because I'm being mindful of time. So I think I'm hearing from people that we need to, at the April full board meeting, be fully prepared to take the time to set our priorities. It's a tough discussion, but I think it needs to happen. We'll gather the information that we have. We'll have the spreadsheet out, and we will spend time developing that priority list. And we will stay here until we have one, that we all agree on what our priorities are. I think at that meeting, I'm hearing people saying, we need to also look at what we're offering. Are we saying we want a series of $10,000 grants? Are we saying we want this? And I think we have to have that conversation about, are we dividing the money equally up into pillars? Are we saying we're going to give so much money to treatment, so much money? Again, those are the discussions that they need to have. And then we can actually get some feedback from all of you from this application. We can redo it a little, and then at the end of that priorities, looking at funding, then look at the application, and that is our entire April meeting. Other than Paul is going to do a short presentation on the 1,000 Lives campaign, but other than that, nothing else is on that April committee meeting except to finalize our priorities in the process for the grants. Is that what I'm hearing?
So when do we do the application?
The application, what I'm hearing people say is they're uncomfortable deciding on an application unless they know what their priorities are.
That's not what if you were basing off of mine, that's not what I said, but.
I heard a couple people, not just you, Liz, I heard a couple, so.
I guess I'm saying that's not what I said, but I'm saying we just need to be, I think having priorities will be helpful for making adjustments to this. I wonder can we have this, like, can we get this in a copy and then be able to provide I just need some time to think it through and think through some of the things. And if we could provide some feedback to you, Mary, that are like, look at this, here's an example of one that could be helpful. It looks awesome. It was the thing I was saying is more about like, is this going to be used broadly or small in priorities? That was my concern.
Thanks, Liz. Paul?
When you say priorities, what do you mean? Because I thought we've already done that.
We have.
Why do we have to do that again?
Because several members said that they want to redo them because we've allocated. So we took the only top priority we didn't do in our list was, because we ran into some difficulty, was the school one. Other than that, we went through our list and basically funded in the 9 million our priority list.
Okay.
So now we're down to the next level of that priority list. And I'm looking for mine, I just had it here a second ago. And so there was discussion that it's, again, we don't have to have it. For instance, under prevention, your top priority was the BAR program, which we didn't decide to fund because it ran into some roadblocks. And we went to flex funding. And so we did that. Now, the other votes that you had in your priority list were enhanced support network, got one. We did a leadership. Prevention really doesn't have a second one. Under treatment, the top priority was detox, and we did that. The next one was low barrier MOUDs, especially in rural areas, and residential treatment. Then in recovery, we talked about supporting, top vote was recovery centers. And then the second, there was a bunch of twos, which were basically respite beds, recovery residences, even dental care. No, I only got one vote. Then under harm reduction, we funded the top one, which was flex funding. The second thing under that was to talk about mobile units, a full range of treatment and harm reduction services. That received 3, and they expanded shelter and housing first. So you have a list. Then there was there was workforce development, loan forgiveness were the top 2 getters. So you have a list. Somehow, again, and so Mary developed this because people said that this was no longer the priority. So Mary developed this list and asked people one more time, now that we've gone and taken the top tier and done it, we have a bunch of that had the same score, had 1 or 2 votes. Now we're at that point, so do we re-look at it? And that's what this attempt was, to re-look at it to determine what our priority list would be for this round of grant applications.
And can I add on to go a bit to the next level of seeing if there were specific recommended programs or activities within each of these categories that council members were interested in funding, so that we could go back and look at the research and say, all right, here's where the gaps are. Here's what supports that or maybe doesn't support that. So all of our decisions, or more of our decisions, are evidence-based. And they have that sort of logic model flow and format. Based on the feedback so far, it sounds as though instead of having this discussion at the Program and Grants Committee, it'll be pushed to April. And so it's okay to request that within the next week, if folks who haven't already, even if you just outline new priorities that you don't see listed, I need those so that we can incorporate them and do the research ahead of time and have the discussion as comprehensively as possible.
Mary, I don't know about that.
And it was only sent out to the programs and grant. So that, yes.
Oh, it wasn't sent out to everybody?
No, it was just programs and grant because we were initially going to look at it.
I made the assumption, I'm sorry, I made the assumption it was sent to everybody. You know what, at this point?
I'll send it to everybody.
Send it to everybody.
Thank you.
Ellen,
Just to add on to that, I think once you all decide on priorities just for this round 2 funding, and keep in mind it's just for this next round of funding, not for like the rest of the money, then it'll be much easier for you all to continue to make an informed decision about how much money you want to send out in this round 2. And then based on, once Mary and I have an idea of like what you all want to fund and how much you want to fund each of those things, it'll be much easier for us to go back in and edit this grant application to be much more tailored to, I think, what you all are looking for. I think we just need that information before we can move on with creating this application to be the best application it can be for this second round.
Thank you. Todd?
I have to go, so maybe I have a tendency to oversimplify things, so
No,
I
like the way you think.
So, first off, I'm impressed. I think this is a really good first step. In my mind, it sounds to me like it's easy to overthink things, right? So we have a number of things, right? There will be times when we put out an RFP for specific stuff, and I think that base that you have can get very specific if you wanted to. I think we've had, I don't know how many people come to us with projects already, right? But does that mean we're gonna have an RFP in each one of those categories? I think not. I think so how are we gonna, you talk about these priorities. I'm more than willing to do that. I apologize that I'm probably one of those guys that haven't done it. I'll make sure I get that taken care of there. But my point is that I think that let's get specific where we need to. I think we have the ability to do that. I think there are people here with lots of experience in this arena. I point towards Ben and others that can help us be specific. But let's not slow this process down any more than we have to. I think this is a great start. I'd like to see us, have a process. Maybe it's not one size fits all. I don't see how it can be. Because if it's just, if we we're just waiting to send an RFP before we accept projects. I don't see how that's gonna work. We have a number of them, and I'd like to send $75,000 down to, who's the guy at the lab who's gonna study the next naloxone?
Oh, that's right.
Why are we waiting on that? I just use that as an example. I'm just saying, we're gonna issue an RFP for that? Maybe we are, I don't know. But you see where I'm going, is I really think there's a good base here. I think we can build on it, get everybody's concerns, and focus on the pillars, but not eliminate simple projects, small projects.
Correct.
That it doesn't.
So would it be helpful if the grants committee, sorry, Joe, if the grants committee developed I think at one point we said the finance committee did, a recommendation on grant levels. For instance, I hate to do it, but I live, sleep, and breathe the local United Way grants. Okay, it's what I've done for 20 years. They have 2 levels of grants. They have the $5,000 to $10,000 grant, and then they have a middle one, and then they have up to $50,000. Do you want the grants committee to propose something that has different levels on it to bring to this committee, not vote on it, but bring to this committee to look at and determine? No. Okay, how do you want to do it then? Oh, Joe's gonna stand up and then I'll take it.
Well, I want to just sort of state that, I think Mary and Ella are trying to work on a process. This is a robust process. It's not static. This is for the next 20 years. So I think that we're always going to be looking at priorities. That's the nature of their document. I think what Liz outlined around the application process and what's been talked about with big RFPs, ongoing funding. So I think that's it's a work in progress all the time. And I think that's how I would want us to look at the priority document. And we always need to be relooking at that. Not every day or every week, or every month at this point, but there is sort of an ongoing process that needs to happen. And I do think that the grants committee that does need to look at what you suggested, Pat. So I would take that as a charge, and we can quickly look at it and bring it back to the group.
Thank you, Joe. Ben?
I was just going to acknowledge that. I mean, I also, someone else acknowledged it before. There was some very specific feedback that no money should go out to specific providers without an application that was open to everyone. There was several people that felt that way, and 2 people? Okay, maybe it was two. So
I know, I was one of them.
But I knew, I wasn't going to bring up Courtney. I knew it was Courtney. She's not here. So, but I just want to make sure that because that's, I think, the tension that we are feeling here of having a broad, and that it's not priorities. It's the how we're making decisions here. Yeah. It's a decision-making process, and I think this was in response to, I think, that request, and we've been talking about it over time. But I don't want to put you on the spot, but
So all I know is that, and I'm fine with the money that we've allocated so far. I think it's great. I'm just saying, before we make any decisions, we need to have an open process to the public for people to apply. We've had people come speak about priorities, but that wasn't an application. So I'm just saying, I think we need an application. I think this is great, what Mary has come up with. I might need to be fine-tuned, but I'm just saying, I think we need to open it to the public to be able to apply for whatever those, our 4 pillars are towards those places. I'm just saying, I don't think we should be picking and choosing.
Right.
And that is all I'm getting at, because we've already allocated 9 million. That's half of our money as of right now, without opening it up to the public. So basically, I get emails all the time, when's this happening? And I'm telling people, well, just send an email to the council. Just send an email to the council. So that's all I'm getting at, is I don't know how the process is gonna work. I just feel we need an application process. And I think that this looks great. That's where I'm at.
I think the tension was not about, it's not necessarily so I guess there's like three things happening. There's like, we shouldn't give any more money out unless people have gone through an application process. There's like, that's one comment that was made. Another thing is whether or not we have an application that's just like, give us anything, or whether we have an application that is like a little more targeted, like these are the things, we are looking for applications. Anyone can apply, but we're looking for applications that meet this need based on this priority. So I think the thing that was said in the grants committee was like, we shouldn't be cherry picking or things anymore, and we should have an application process. But I don't think that precludes us from making an application that is more targeted.
I really agree, I agree with that, because I've talked a lot with Courtney about it, and I do think that's it. It looked like some people were cutting line, and she felt very strongly, I think Monica too, that no, everybody needs an equal opportunity. Now that's a little different than saying an equal opportunity to apply for everything.
Right.
Or anything.
Right.
Agreed. The same people that might do a really great community event is different than an organization that might put up a substance use treatment facility with 30 beds for. That's a much different thing. And so while I've been talking a lot with Courtney about, and she wouldn't mind me saying this stuff, about, she really wants everybody to be able to apply for everything. I said, there needs to be more focus, because it's really not fair. And I kind of agree with the sheriff too, that we've almost made it too complicated. The application, to be able to do a straightforward application. Then what we do with the application, what we put out there, we need to send things like, well, we've got $3 million in this bucket. We're interested in these things. Send in your 200-word, 600-word concept paper on a 2-year budget. I wouldn't do anything less than 2 years, but I wouldn't do 3. We'll do 2 years, and then we'll get back to you, so that they don't want to invest a tremendous amount of time in this, because this should be the easy part. We haven't even gotten to the point of who's going to score these, and on what basis are they going to score them. Now, I would submit that we need to do, that we might, on this first bid, maybe we can try to do it ourselves. Break up in groups of 5, groups of 3, but we have to have some training. I'd like to see Jim and Deb come in, Ben, or somebody from MEAP, and talk about, well, these are the ways that you can do. You get 20 points for a budget, you get 10 points for this and 20 for that. I mean, I don't know how to do that. And so the hard part, and we don't know whether we're going to get, and this is where the rubber meets the road, we don't know whether we're going to get 10 applications, which we might do if we did a very focused thing, or whether we're going to get 1,000 applications. I also think there should be no appeal process whatsoever. We're not obligated to accept appeal, and as soon as we tell people that they can appeal, everyone will appeal. It holds up the things for the state for years at a time. So I think, but I honestly think that we could accomplish all of this in about 2 or 3 meetings with the grants committee and this group. There's nothing more important than we're going to do, get an application and decide whether, we don't have to do it all at once. We could say, well, let's try this. We got an application, and let's solicit projects in the harm reduction milieu, and see, and I think we should tell people how many we intend to fund, so they know what their chances are, and how much total money we have. I've said.
Yeah, you need to say something about money.
I just want to say thank you to Mary and Ella and anybody else that put that together. I mean, I think you guys did a really good job.
You did.
And the second half kind of fell more in line with what we were talking about here. It's kind of that focus. And I think even though it's been really a robust conversation, I think it all falls in line with where the conversation is going as much as possible. So thank you for the work you did.
Of course, that was the intention.
You did a good job.
Ben?
I would find it helpful if we have a running list of all of the requests that we've gotten.
Okay.
I do have
that
a
exists or not.
We have a folder.
But I can make a list so that you don't have to open every document. And those are also going to be included in this spreadsheet so that you can see specifically who's reached out, who said what.
Do you want every request? Because some requests are for personal funding.
I think, yeah, like that.
So I mean, personal
the way that
funding,
I'm
maybe.
envisioning this, I think what I hear people wanting is like, we need a request for information, like, give us your ideas, basically. A very high level, like something like 10% of that application, so that people can like send us what they think is needed out there. And then we can like have a running list and categorize it and say, there's 27 people over here that are saying the same thing. Let's set up an application process for this, and based on the input, so.
Okay, so you don't mind if I generalize it, because I don't want to use people's names? Because we get requests like, my family needs money, can I have some of the opiate settlement funds? And then we have also people who are saying they want to bring those we have people who make requests because they have no insurance, and will the council pay for my treatment? So we can, if you don't mind generalizing those, they're not in, I don't want to use people's names, but those are some of the requests that we get. And I do want to tell you that I don't think there's anybody, knock on wood, I know, that doesn't get a response from the council within 24 hours of their email. So everyone who has responded to us gets an email back. But some of them are very personal. They're not requests. Ella?
Oh, sorry. I didn't mean to interrupt.
No, go ahead.
I just was going to say that I think something else that has been brought up before, but I'm not totally sure where we went with it or what was decided, but along the same vein, it would be really easy for Mary and I to send out an intent to apply so that we could see what people out there are looking to apply for before we even continue to develop this, or as we continue to develop this, because to Ben's point, it might be easier to see like have data on what people want to request. And that could be like a very simple form that we just send out. That would help us have an idea of what the other end of this process would look like a little bit more.
Okay, great suggestion.
That's drafted. Like, you all give us the green light to send it out and say, send it to the recovery inbox by April 15th. Like, send it out tomorrow.
I think we just need to know if we have the go-ahead, because I do think that that's something worth discussing, because it is a very simple on our end first step, and it would be helpful in understanding how to move forward.
So, okay, two things. So I'm going to have Mary add somewhere, I think in this spreadsheet, it might be interesting to see email priorities that we received in this list.
Yeah.
So she will add that. So we're going to have the grants committee working on things. We're going to have finance working on certain things. I would like to, because the last time you said you wanted a certain structure for the meeting, at this point, other than Paul's presentation about the 1,000 lives, I would like to leave the April meeting open so that we look at where we are and have that April meeting be all about finalizing how the funding works in the application process, if that works for everyone.
That's what you said. We have a list of those folks that have the intent to apply. Can we have that?
If you want her to send a letter out, they can send that letter out.
I think that's a different thing. Yeah, I think that's a great idea, though. I mean,
it happens. I'm not sure if it happens a lot. It used to happen a lot with grants. You sent a letter of intent in, and then it gave you no obligation to apply.
it kind of lines in with what Ben's trying to get.
So we can send that out. I guess we'll get the word out there that.
Although I would say we did a survey and had a public hearing, so we have a really good sense. And I just think like knowing what our process is going to be and having people doing a letter of intent that's related to what we're actually gonna fund feels like a more authentic and sincere thing than like, tell us everything when we already asked you everything. I just don't want people to get frustrated with us, like they're writing letters of intent when we have no intent of actually giving out money in that area, or even remotely close. I just think
it just gives you an idea. The letter of intent is, I would say in that letter of intent, please don't send me anything more than a page. The letter of intent really only is to say, I'm gonna apply for money and this is what I'm gonna apply for. But
I know,
again,
I
if
just
you-
wrote one and it took us 2 weeks to prepare for it, so we knew that we weren't gonna screw it up when we go to apply. I'm just.
It's up
not
to you.
small.
I'm just gonna take a quick consensus, because this is about Mary and Elle's work. Is the quick consensus, raise of hands, not a vote. Do you want a letter of intent sent out before the next meeting? All in favor, say, raise your hand.
Done.
Any opposed? Okay, well, that went as a consensus, so we will send a letter of intent. Let me look at that and see how that works.
I don't want it. Oh, I was saying I don't.
All right. Anything else become before the council, because you're already 15 minutes over? She's already in the car. Oh, she's already late, okay. Meeting adjourned. Thank you all those who are online.